Las Vegas. I am so glad you are with us. This is our biggest conference ever, the 55th year, and this year, there are almost 50,000 people in attendance. I'm Adam Johnson. I'm your host here on HIMSS TV, and over the next several days, we're going to bring you live content several hours every day, interviews with people who are making a difference, who are saving lives, who are coming up with solutions to put all that data to work so that we lower healthcare costs. There are just so many themes. Security, how do we make all that data secure? These are the types of issues we're going to be wrestling with, and I can assure you we're all going to learn a lot together. So I tell you what, let me get right to our first guest. He is Chuck Webster. He is president of EHR Workflow, and he's also a HIMSS social ambassador. You are a man who has found religion, and you have come to the mountain.
Adam, great to be here. And I came to the mountain in 1994 for the first time. That was my first HIMSS conference, and I've come to most of them since, and everyone is better than the last.
Yeah, I mean, this one in particular, this year, I mean, the excitement is incredible. You're excited about artificial reality in healthcare.
Yes.
Explain to me, and you even brought some goggles as a visual cue. I'm afraid to put those on. I'll let you do it. But how do you use it?
Well, virtual reality is about creating an environment in which, while you are looking through the virtual reality goggles, you feel as if you're in the environment. Virtual reality is useful for example, helping with pain management, so children can be distracted from pain by playing games. It's useful for training. You can greatly accelerate the speed with which you train through repetition of doing the thing in virtual reality.
In other words, I'm a doctor. I am practicing a certain procedure. I can put on the goggles and...
Exactly. In fact, there are situations where they scan the patient and then the doctor can actually look at the virtual representation and look inside the patient as if they were Superman or woman.
Amazing, and obviously it's all in 3D, so it's real, as opposed to the old original stuff that was not. How about hospital design?
That's because of my workflow. I'm sort of Dr. Workflow in healthcare.
That's your Twitter handle,
Twitter,
Dr. Workflow, at Dr. Workflow.
Yeah, if you search for that, Wareflow, W-A-R-E-F-L-O, no W at the end.
Right.
But we're almost to the point where a hospital architect could design a healthcare building or system or structure, push a button, and it becomes a virtual structure which people can go through and actually simulate the patient experience and understand the steps of the workflow to improve it.
All right, so I'm going to think outside the box here. Let's say I am a designer of those high-tech rolling beds, right, with all the different systems in them. It's a little bit wider than usual. I could take those specs, put it into an AR environment, and see if we can get through the doorways.
Perfect. That's a wonderful example.
I made that up.
But
yeah, well, we're learning here at HIMSS. So as you walk around the show floor over the next many hours and several days, what's your message to people as you try to talk about AR and how to introduce it to their business?
Sure. I call this the 3D-ness in healthcare. The 3D printing, virtual reality, both involve digital representations of three-dimensional objects that can then be printed into the real world or actually scanned and viewed in the virtual world. So there's this tremendous opportunity to simulate and to improve complicated systems.
Understood. And you're also leading a couple of panels, correct?
Panels in virtual reality. In fact,
of course.
If you go to Twitter and you go to HIMSS VR, HIMSS for virtual reality, hashtag before that, for 2 hours yesterday and 2 hours tomorrow and 2 hours the next day, in virtual reality, if you have a headset, great. If you don't, you don't need it. People from all over the world yesterday, 25 people from Egypt, Istanbul, all over the US, people who couldn't be at HIMSS got to participate and have a HIMSS virtual experience in social virtual reality.
And actually that's part of the reason why we're doing HIMSS TV. For everyone who actually can't be here, we are your here. So
and guess what? And guess what? We had a 10-minute loop of you playing in the background.
I'm sorry.
30 or 40 times. We eventually turned the sound down, but the first time everybody was quite rapt.
Paying attention. All right. Before I let you go, what's the first thing you're going to do when you leave us here at HIMSS TV and walk into the incredible conference room floor that's just 50 feet away from us?
Well, I've been hearing incredible things about Intermountain, and they're doing some really cool VR stuff. I don't know much about it yet, but I have Janae, your next guest, to thank for putting me onto that, and that's where I'm going to go.
Intermountain is based out of Utah. What is it, a healthcare system?
A healthcare system that's known for innovation and coming to HIMSS and telling people about its best practices.
And they are enthused about AR, presumably, which is why you're
and virtual reality, yes. In fact, they've invited me to come there and maybe do my social virtual reality from their booth, which is fantastic.
Right. Well, I tell you, what a pleasure to speak with you, Chuck.
Thank you, Adam.
We can tune into your specific panel when?
Tomorrow from 3 to 5, and the day after from 3 to 5. And if you search for #HIMSS VR,
well, you're like a regular commercial.
You will find lots of links out there. You download the software to your PC or your Mac, and even if you're here, find yourself a little booth or a cubbyhole and participate in what's really a cool virtual reality experience.
Oh, it really is. Okay, Chuck, thank you.
Thank you, Adam.
All right. So obviously you've just met Chuck. We have so many people coming to you. I kid you not, literally like every 5 minutes we're going to be interviewing different people who are making a difference here at HIMSS, and certainly not just part of the dialogue, but actually leading the dialogue. So I want to introduce you to someone by the name of Janae Sharp. She is the Chief Strategy Officer at Lively Insight. And welcome.
Thank you. I'm happy to be here.
Yes, well, we're happy to have you. I'm fascinated, as I was reading about your bio, you actually look at doctor burnout.
Yes, that's one of the things that we've done some work in, looking at physician burnout and what impacts that. Why are people having a difficult time? What should a solution really look like?
Right.
And one of the first things that healthcare systems should do is really quantify what that looks like. Like
what burnout looks like?
Yeah, what is really happening with the physicians that you're working with.
Can you, and I don't want to reveal any identities, obviously, but can you give us an example, speaking sort of generically, about some of the doctors that you've worked with, what they've expressed to you, how you've dealt with it, and how you help them get back to treating patients?
Yes, a lot of physicians that we've talked to talk about how medicine now, how they're practicing it, isn't what they expected. And it isn't fulfilling to them. They feel like they're sitting behind a computer and making clicks and just cogs in the wheel moving forward.
Data's supposed to be our friend.
Right.
Right?
Yeah.
And like now it's a bad guy.
Right. And I think a lot of them see all this documentation, all these regulations as a burden.
Right.
So they hate their EHR and they have no joy in medicine anymore.
Oh my God, and the whole reason people, I mean, I almost became a doctor. My economics professor at Princeton actually convinced me I like economics more. He was probably right, but there's a passion that has to be there. I didn't have it, but friends of mine, roommates of mine did.
Yeah.
That's why they became doctors.
Right. I think a lot of them are idealistic. They want to heal people. They want to help people. It's not because they want to be rich, because they could do something else.
Right.
And then they come into the clinical environment. They're emergency doctors. They're working all night, maybe with trauma, and then they have to document sometimes for 45 minutes for each case.
Oh, that's crazy. You might be with the patient for 5 or 6 minutes and you're documenting for 40 to 45.
Right. And some of what we're doing is looking at that data within an EHR to say, how much time are our clinicians actually spending in documentation? What is actually happening in their workflow?
Right.
And that knowledge can really help you solve things and come up with great solutions.
Examples of solutions. Help me figure out how we get from the pain of 45 minutes of processing to, I don't know, maybe it's 15 or 20, or maybe even 7 or 8 one day.
Right. Well, there's a broad spectrum of technical skill.
Right.
So,
yeah, okay,
so I think for some, it's difficult. It would involve healthcare leadership sitting down with clinicians, looking at their workflow after we have this data and saying, what are solutions here? Would it make sense for someone to have a scribe? Does it make sense to have you be trained really well? When you have EHR implementation at a hospital, you can lose millions of dollars if your clinicians don't understand how to use it. And they're spending 100 clicks to document a case. So we'll look at them at the actual data of what's happening and then say, okay, for this physician, we can get a specialist in here who understands computers.
Right.
And they will either train them or they would have a scribe that would work better.
So you know what's fascinating to me about this? You talk about 100 clicks. I would have guessed that, not being a doctor myself, that clicking would be faster than writing longhand, but it might be more cumbersome?
Yes, it is more cumbersome. A lot of the times, people don't like to do what they're bad at. So if a clinician doesn't know exactly where things are, they're frustrated.
Right.
And they also don't really appreciate finding the correct circle to fill in. And there's also a different process that happens when people write. They remember more,
Yeah, true.
and they connect more. So that separation of digital technology, for some, is difficult. For a younger, technologically savvy clinician,
Yeah.
it might be their preferred method of notation.
Yeah. Well, I tell you, so much to wrestle with. Before I let you go, your company, Lively Solutions, you have a booth here, or Lively Insights.
We don't have a booth here.
Right.
So
you're roaming the floor.
yes, you can come find me.
Okay, we will come find you. And how do we reach you? Do you have a Twitter
Yes,
handle? Or
find me at Coherence Med on
Okay.
Twitter, or search for Janae Sharp.
search for Janae Sharp,
Yes.
which is spelled Janae.
Yes.
Understood.
Well,
All
thank
right.
you so much. I appreciate being here.
Oh, thank you for joining us.
All right, thanks.
All right. So as you can see, there is just so much to cover and so many different topics. I hope you're learning as much as I am. It's almost like taking a sip from a fire hose. And I tell you what, I'm about to learn who our new guest is with you live right now. His name is Mitchell Parker. He's the Executive Director of Information Security at the Indiana University of Health. So Mitchell, thank you for being here.
Thank you very much. Thanks, it's great to be here.
Yeah, well, tell us what your message is as you come to Las Vegas from Indiana.
Well, today I come with two messages. I'm giving two presentations here. First one today is actually on cybersecurity staffing and how to pick the right team members.
Oh yeah, that's one of the key themes, security, and specifically, yeah, how you go about it. How do you?
So one of the approaches we've taken at IU Health is that we take a look at how we can build the right team that can interface with the rest of the organization. Our focus is that cybersecurity is a business problem, and therefore to solve business problems you need business people to help understand the problem, find the root causes, and address those root causes with the rest of your organization. So instead of being in a situation where you're putting in people just because they know cybersecurity, we put in people to solve business problems, communicate with the rest of the organization, and make sure that we have a good communication plan for our organization.
I'm fascinated that you describe it as a business problem. I'm not sure if you had asked me what kind of problem it is, I'm not sure I would have said business. Why do you attach business to security rather than just more of a kind of a social issue?
The reason why I do that is because when you take a look at what the major data breaches have been over the past few years,
right?
We actually did this. First time I presented to our Chief Operating Officer and his team, we spoke specifically about the number of data breaches out there and what the root cause of every single one of them was. Now, a good way to have welcome to the organization is to be in front of a room of 30 executives and to tell them, okay, here's 7 major data breaches, 2 of which one of your SVPs gave me less than a week ago when I was prepping this PowerPoint deck.
Right.
So it's like, okay, here is the root cause of every single one. When it came down to it, every major data breach we talked about had its roots in not staffing correctly, not having proper maintenance, and not having proper upkeep.
No kidding. So it wasn't necessarily bad software, it was bad people behind the software.
I wouldn't call it bad people behind the software, I'd call it bad processes. You don't ever want to be in a position where you ascribe blame to anybody for that kind of situation.
Oh, interesting.
I mean, look how it backfired on the CEO of Equifax when he threw an unnamed employee under the bus.
Right. Yeah, he was gone. The CEO was gone like within 48 hours.
Exactly.
A very trusted, well-known guy in the business.
Absolutely. So when you take a look at it, you have to build a team. you have to have everybody working together, and you have to have a cybersecurity team that people feel comfortable in reporting these issues to. Because if they don't feel comfortable speaking with you,
right,
they're not going to report issues, they're not going to work with you.
Of course.
And if you're the team of no, they're never going to work with you.
Well, and if you throw someone under the bus, obviously you shut the whole thing down, which is your point.
Absolutely. And we just won't do that.
Yeah, right. What do you look for in a person who's going to join a team like this?
Well, first of all, I look for an ability to learn. I don't want someone that comes in saying, I know X, Y, and Z. I want someone that comes in that goes, I can learn X, Y, and Z very quickly if you throw a book at me.
Yeah, right.
I want someone who's willing to communicate, willing to work with others, has empathy, and is somebody the customers are willing to speak with.
A people person.
Absolutely.
Huh.
You have no idea. We did a security education program at IU Health a few weeks ago. We had somebody come up after the presentation,
right,
internal customer who runs one of our charities for Riley Children's Health. And she came to the presentation because she was curious about cybersecurity. We ended up with a new customer out of that. So, and that's the way we work at our organization is we have to be people. We have to communicate. We have an excellent partnership with our corporate communications team, and we like to keep it that way. And we also are very focused on employee engagement.
Sure.
And as I tell our human resources department, we focus on employee engagement because if I don't focus on it, my team will find other places that will.
Yeah, and before I let you go, I'm just curious, you talk about these people are people persons. What kind of degrees do they have? Because this is a new business,
so
a whole new field.
My number two, my director, Paul, he has his master's in education.
Right.
I have people with degrees in finance, computer science.
Huh.
My top project manager has his degree in business. I have very few people with computer science degrees. Matter of fact, my top technical person does not have a degree.
Yeah, amazing. That's why I asked you, is that diversification, that diversity of people. I'm so impressed. Mitchell, thank you.
Thank you, and thank you for your time today. Have a great day.
Oh yeah, you too.
Take care.
So I tell you what, we have an opportunity now to share with you the conversation I had with John Whalen yesterday. John is the Executive Vice President of HIMSS. This is his life, it's his passion, and he has so much to share. Here you go. John, the 55th annual HIMSS, I think you're setting a new record for attendance, aren't you?
Yeah, no, it's early days, first full day today, pre-conference workshops and everything, and the numbers are really good, pacing well ahead of last year, which was one of our biggest events. So we're expecting, if not a record, but a fairly good event this year.
And the people here are so passionate about it. You walk into the room, I mean, you feel the energy. They want to be here.
Yeah, it's always amazing watching people come for the first time.
Right.
You know, when they actually get to see what it's all about. And you get to see the whole world of healthcare and technology on that floor, and people from all over the world come. It's a global conference,
right?
And the kinds of people that come, you know, it's the world's best and brightest minds, doctors, physicians, technology innovators, people that are sort of really engaged in tackling the big problems of healthcare in really creative ways. So the energy's huge, and what you see on the floor is, you know, contingents from all over the world that come to share these ideas and this knowledge. So it's a really amazing event. It's unique. It's really unique.
Yeah, it really is. So how do you actually try to organize all the different vendors, all the different participants who want to come? It's not easy.
No, it's not. So to participate as an educator, it's a really rigorous process. It takes all year to build the program. The program is vetted by, you know, all sorts of subject matter experts, research in the field, feedback from the members, the volunteers, the communities.
And it's substantive. This is not big picture stuff. People here know what they're talking about.
Yeah, they do.
Yeah, the audience expects it.
They do, yeah. And so the quality of education is really high.
Right.
So there's a trade show floor, which is massive, and where there's a huge amount of conversation goes on. Last year, we think over 400,000 conversations took place in 4 days. So that's one piece of it. At the same time, there's over 2,000 hours of education. So thousands and thousands of people are going through those education sessions, taking with them ideas and practices, best practices, and knowledge that they can apply back home in their institutions. So,
yeah. What do you think the themes are this year?
Innovation, I think, is a big one, obviously.
Sure.
But that's more of a sort of a thing that runs through the events every year.
Right.
This industry thrives on innovation. It depends on it for two main reasons. One is to sort of pioneer new ways of tackling some of these huge problems that face healthcare and today. And the second thing is innovation is a major way of controlling cost. If you can actually figure something out and do it in a creative way, it can end up saving you a lot of money in the long run. And particularly for hospitals and healthcare institutions, doing that, innovating and eliminating expenses is a huge problem and a huge challenge.
Well, one of the things I've noticed is breaking down silos, right? If you can somehow break down the silos, then the information can flow. That's a cost save right there, isn't it?
Right, oh, absolutely. And I think some of the other themes that you're going to see this year. Cloud is a very significant portion of what we're doing here. AI. So we had a show today where they have standing room only. 8:30 in the morning, people literally packing the bags of the halls to tackle that one. So that's a big theme this year too. And I think the other thing too, there's a really big theme this year, which has always been here, but it's probably more prevalent than ever before, is the global conference. This is truly a global conference, global solutions, lots of people involved in doing that. So that's a big theme that I think has emerged this year and will be a dominant theme for us for the next few years as we build a global aspect of the conference. Yeah.
Sure, well, one of the things you're doing to make it more global is HIMSS TV. This is a first.
Yeah, absolutely.
How'd you decide to do it?
Well, I think the idea has been, kicked around for quite some time. The audience that comes here, it's a huge show. I mean, as I say, over 45,000 people come. But most of the people that come are one of two people that come from every department or place or workplace across the world that's engaged in healthcare and technology. So there's a huge interest back home in what's going on at the show. And they used to rely on things like emails and the news that we post and everything else. But TV is a way to bring it home right away.
It's engaging, right?
Very engaging.
Yeah.
And I think it does a really good job of capturing the energy that you see at the show.
I think so.
Yeah.
I mean, we've got the sound of people. They're walking by as you and I are trying to speak. Sometimes we have to shout a little bit over them, but that's kind of what you want.
Yeah, exactly. Yeah, exactly. Yeah. So I think the energy is a really important thing. Also, the other thing too is that the way people are consuming their content now.
Right.
Video and TV are huge parts of the way that people consume their content, especially their news. So all those things together made perfect sense to try a TV thing. So here we are in our first year, and we're very happy with the results so far.
We certainly are. So this content, for example, our conversation, that gets pushed to people via email, it's on social, it's on websites, it's playing in the elevators of the hotels, on and on and on. And it's really going out to as many different places you can send it. And look at that, people are already trying to find you.
Yes, exactly. So.
That's good, you're man in demand.
Yeah, no, absolutely. So, and I think, HIMSS operates in over 52 countries.
Right.
And has a massive global audience. We sort of connect with people all over the world all year round. So with TV, I think it's a more intimate way of us connecting with that global audience day in, day out. So we're pretty excited about it.
Sure, well, we're going to let you go connect with your iPhone and your iWatch, et cetera, et cetera.
Exactly.
All right, John, well, congratulations. 55th annual, and as you said, record attendance.
Yeah, thank you very much.
Well done. We'll see you in the exhibition hall.
Thanks very much. Thank you.
John Whalen, obviously a very thoughtful man and very passionate about HIMSS. He's the Executive Vice President. All right, so I want to introduce you to somebody else who is incredibly passionate about what she does. She is Danielle Sierra. She is the founder and lead publisher of a site called InnoNurse. And you talk about all the innovation, digital innovation, on and on and on happening in the nursing industry.
Yes, you got it. Thank you so much. I'm glad to be here, and we're going to have a good time. So InnoNurse was a site I created, I coded, and with the concept of showing what nursing informatics is globally. I coded it and I find different digital devices, people, information in 7 different languages, and I share with my followers. So people kind of use my site as a filter to find information.
And you have a lot of followers.
I do. I'm trying to make friends. So
well, you're good at that.
I try to make friends.
So, I mean, on Twitter, you're at InnoNurse, and you have how many?
Twitter, 6,000.
6,000, and then the actual site, InnoNurse.
It's probably gets about 1,000 views a month in 60 countries.
In 60 countries?
Yes.
So I saw a wonderful thing on Twitter, actually. It was a picture of all of the cords hanging off all the life, preserving devices in an emergency room, and it said, "I'm a nurse. This is what I do."
It's pretty
and
much.
And you're welcome, by the way. Yeah, right? That's literally, that's what it said.
Pretty much. When you're a nurse, the whole thing, and I've talked with colleagues I've seen years later, I saw someone recently I worked with, and it's about being focused and being calm in the moment. Because I always say panic doesn't help anyone.
No.
So really to focus, know your practice, know your science, and just go right down the line and do what you know how to do and what you're calling.
And over the time period of your being in nursing school to where we are today, how much more digital, how much more machine-oriented has nursing become?
Well, my first degree, my bachelor's in nursing, we were already on computers. So I had already started and was charting, but as I traveled to other states and other countries, I found people were still on paper. So it was a little jarring to leave the San Francisco Bay Area and to go other places. And everyone was hand charting and passed me a pen and a piece of paper. And I'm like, what's that? Like, that's how you chart. I was like, no, I really don't, I've never charted on paper. So things have changed, I've seen globally in 30 countries. So from the time that I got my bachelor's in nursing, time I had my master's in nursing informatics, where we're now coding and making our own apps, we're making our own sites. Now I'm building chatbots. So as I say, it's come a long way, baby.
Yeah, sure has. So have you. You started off as a nurse and you've kind of morphed into, well, so many different things, almost a programmer, certainly an entrepreneur. I mean, is it getting to the point now where nurses are able to do some of the programming themselves, to actually write code? I mean, is it that?
They do. Globally, they do. So as I always say, I'm still a nurse, I'm a registered nurse, so I'm just not a touchy nurse.
Right.
And so now it's more me dealing with computers, and there's nurses that I work with in Malta. They went back, got a computer science degree on top of their nursing degree in France, where they did the same thing, got a computer science degree. And they're basically doing nursing informatics, but just really focusing on that technical part and then coming back. And as we say now, we're the nurse for the nurses.
Right. Digital Bridge, tell me about your partnership with them.
Oh, so much with Digital Bridge. I'm glad you brought that up. I saw a couple different items we were discussing. Cerner I've worked with in the past, Epic I've worked with, and the big one was working with like WHO Europe and engaging with them. So I would say those
World
are
Health Organization in Europe.
In Europe. So being able to go to the Nordic countries and work with IDC, welfare tech, and really spent a lot of time up there. That's where I learned about VR and AR and seeing it from the patients using it with the clinicians and how they engage together. That to me was like a big, when you're talking about that turning point, to see VR and AR in the hospital before it was actually out here in the US and people were using it. It was already mainstream there.
Really? How are they using it?
I went to, I say it correctly, the island's pronounced Sandnes from Norway outside of Oslo, and it's a rehab center on this island. And they take patients that are going to be, you know, they might be a month, 2 months in the hospital, and they have an actual physical room where they do all the physical therapy, all the occupational therapy, and they actually compete with their physical therapists using like the Wii and different tools.
Using augmented reality.
Yes, so they'll have like the glove, augmented reality, they'll have VR, and they'll do different games.
Unreal.
And they've cataloged a library. So you can go, okay, I want to work the trapezius muscle today with the patient, or I want to work the sternocleidomastoid last time. They've cataloged it so the therapist can pick the right muscle group or the right joint group, and then work it with the patient. And the patients can compete against each other and pick the right category for themselves.
And amazing, because they were on an island, they actually needed to do this, right? They couldn't necessarily get people off in the middle of the winter.
Well, that's the big thing. Also, they're in the hospital, and you kind of get a cabin fever when you're in there a long time, so having the VR, be able to transform yourself out of the facility. The other big thing they did there, which now they're doing it here, but it was huge, is the patients have their own laptop and they do their own telehealth. So they'll connect at the hospital with their nurse back home, with the doctor in another facility, and so they can reach out and connect with their providers instantly and have, you know, a conversation. So that's big patient experience I had not seen when I came back to the US.
Do you think that there is a burgeoning field, not just informatics, obviously that's well established, but specifically aimed at nurses? Might that ultimately be a degree that more people start to pursue?
They are. When I go to the Nordic countries, people are getting their PhDs, so it's quite common. Nursing informatics has actually been around 20 years. So when I applied, there were well-established programs, and as I travel, whether it's Spain, France, the UK, people are getting their PhDs in nursing informatics.
Yeah, incredible, so exciting. What's the first thing, I mean, this is the first day of HIMSS now. What's the first thing you're going to do when you leave the desk here and go onto the conference floor with those 40,000 people?
I'm going to shake some hands and kiss some babies and go make friends.
Well, that's what you do very well.
Thank you so much. I appreciate your time.
What a pleasure.
Thank you.
Love it. All right. Isn't this amazing? We get an opportunity to meet so many different exciting people who are doing things that really make a difference around the world, and it's about saving lives and, you know, one patient at a time. So I want to introduce you now to Stephanie Hedlund. She is the Senior Director of Marketing here at HIMSS Media. And Stephanie, good to see you again.
Yeah, you too, Adam.
We met yesterday when I showed up, you know, bushy-tailed and brand new to HIMSS. And I feel like I'm being indoctrinated, and I love it.
Good. Yeah. It's really exciting. I think just the energy and the buzz here is, you know, that's what gets us all. This is our big show, right?
This is New Year's Eve.
Yes, it really is.
For 3 days.
And, right, in Vegas and everything.
Yeah.
So a lot of excitement here.
I mean, it's incredible. I would imagine that just as we're talking, well, let me just, for all of you who aren't here but want to be here, right, there are, how many hundreds of people do you see walking past us? It's like Grand Central Station.
It is. I know, right? It's there's so much energy around the conference sessions. I think the exhibit hall. It's about 9:30.
Right.
It's about to open, which you'll see lines of people waiting to get in just to really learn all about all the great new technology that's here and how they can put that into their daily applications.
What amazes me is that there are booths, obviously,
right.
But there are all these breakout sessions, and there's no way you could ever.
Right.
I mean, it would be like if it were TED Talks, but just on healthcare, and there were hundreds of them every hour. Right?
Exactly. I mean, that's almost half the challenge is navigating not only the show, but all of this great content here, and sort of we say sort of finding your community here and finding like-minded folks. Like your previous guests on nursing informatics, that's a great.
Wasn't that cool?
It was so cool.
It's amazing.
Yeah.
And totally new.
I'm in marketing, but I'm a data nerd, so I can completely relate to a lot of what they're talking about. So it's really neat.
Oh, it is.
Yeah.
So as the person who really is spearheading the whole media outreach for HIMSS, what are the different venues? Obviously, HIMSS TV is brand new.
Yep.
But how is it that you're getting the word out to people who want to be here but can't?
Yeah, so great question. So we've got, so our HIMSS.TV platform is brand new. That's something we're going to be starting all year round, where folks can come online and really be a part of the community, be a part of HIMSS. We've got it, you're going to find our video on YouTube, on Facebook, on Twitter, you know, really wherever. We're trying to go where the audience is, you know, and
social.
Right, social
media.
Yep.
Yeah.
So all of those places we see the audience engaging is where we want to be to help really connect and engage our audience together with HIMSS.
I know the obvious is just hashtag HIMSS2018. There's so many different hashtags. 18. What did I say?
HIMSS2018.
Yeah.
HIMSS18.
HIMSS18.
Yeah.
It's cleaner.
Yeah.
HIMSS18. Hashtag HIMSS18. But what are some of the other more specialized if people want to drill down?
Yeah. So we have a lot of great content on innovation. We have, as Health 2.0 is now part of the HIMSS community, there's a lot of great content here on emerging technology and how we're connecting, say, investors with some great new products and companies. We have a lot of content about workforce development. There's really just a huge gamut of different topics and areas that you can dive into here. It's pretty exciting.
Boy, it really is. Do you have, I don't know, sort of a mission on this particular conference? Is there one pet project that you just really want to usher through and embrace?
Yeah, so I think, you know, right now, so you know, for HIMSS 2018, you know, we're saying this is where the world connects for health. And I think that, you know, the global community and really a lot of what I've heard, I was at our pre-conference sessions yesterday, and a lot of what I heard from the speakers there was just around, you know, how the healthcare community is global, and there's a lot of the same trends. A lot of what we're facing in the United States is not unique to
so
other
let's not
parts of
reinvent
the
the wheel.
Right, and we can learn a lot in that way too. So we have a large international contingent here this year, so it's pretty exciting stuff, Adam.
Boy, it sure is.
Yeah.
All right, well, I will let you get back to it.
All right, thanks.
All right, spreading the gospel.
Yeah.
Okay.
Great. Thanks so much.
So yesterday I had an opportunity to speak with Dr. Bob Wachter. He is the chairman of the Department of Medicine at the University of California, San Francisco. He is an incredibly passionate doctor and a very thoughtful voice on healthcare. I think you're going to enjoy what he has to say because it's almost sacrilegious that somehow EHR is letting doctors down, but he's got a few ideas as to how we can improve it. Dr. Wachter, you have been very critical of EHR technology. Why?
I think we underestimated how complicated it was going to be. We sort of thought it would be like our iPhones, and we'd put it in and download an app and not even read the instructions, it would all be good, and it turns out to be wildly complicated because I think the electronic health record developers didn't understand how physicians think, understand the implications on workflow, and it's not designed particularly well for real users. I think it's getting better, but it needed to get better.
Well, do we need a standard that is consistent across all the different creators of the software, the users, et cetera?
Well, we certainly need a standard that'll let different electronic health records speak to each other.
Right.
The same way I can put my Bank of America card in a Citibank machine and it knows who I am, and if I have money in the account, it'll spit it out. That kind of standard is important. You don't want to over-standardize because you will probably standardize out the innovation. But you certainly want certain standards so that electronic health record screens kind of all look similar, so that when I get in a car, I know what the steering wheel does, and I know where the brake and where the accelerator is. We want that level of standardization, but we don't want to step on innovation.
Who's really leading that charge to actually bring the players closer together?
Well, the federal government is trying to bring the different electronic health record vendors closer together. My feeling is that we're reaching the end of the first generation of EHR technology, meaning that pretty much every hospital in the country now has an electronic health record. Almost every doctor's office now has an electronic health record. I think what we're now
seeing... No more rainbows, right? Where you walk into the office and it's blue, turquoise, purple.
We're done with the paper chart. The 3-ring binder and the Post-it note and the fax machine is no longer the way we store and move data around in hospitals and clinics. That's a good thing. What I think is likely to happen, now you see the entrance into the market of the Googles, the Apples, the Amazons, the Microsofts, the IBMs, huge amount of venture capital coming in, and I think we're going to start seeing the electronic health record just be your core platform, and around it a whole lot of innovative new tools that will make things better and safer. And
then there's always that question of who owns the data and who do you share it with?
There is that question, yes.
Right.
I mean, ideally the patient would own the data, and the law says the patient really does own the data, but at some level the data also has to live in a lot of different places. I'm in a big academic hospital. We have to have the data. The data has to go to a clinic. If you're in a car accident 2,000 miles away, the data has to go there. If we want companies to come in and do big data and artificial intelligence, they have to be able to get some of the data to do that magic. So we have a sweet spot to find here that has data portability for all the people that need your data and will use it for good purposes, without your data next thing ending up in North Korea or ending up with a Russian hacker. It's all pretty tricky.
Well, I'm glad you just said that. How do we keep it secure?
I don't think anybody knows the answer to that yet. I think what's become clear is the hackers are pretty good, that your healthcare data has real value. And it's easy to say, oh, in healthcare, they're not very good at privacy and security, but we've seen massive hacks of some of the biggest financial companies in the world. So the answer is nobody's great at this yet. I think what we've learned is that your 200-bed hospital can't do privacy and security by itself. The solution, paradoxically, is going to be that your data probably goes off into a pretty secure cloud, and that you have access to it, the hospital has access to it, your doctor has access to it when they need, but we need industrial strength solutions if we're going to keep your data safe.
All right, let's think outside the box. What about blockchain, where actually you have that shared ledger, but it's still encoded? Is that a possibility?
It's a possibility. I think blockchain is now one of these things when people say blockchain, everybody says, oh yes, that's the answer. Yes. It will be an answer for some things that allow your data to be kept, I think, more securely. But I don't think we've come upon the final answer to make sure your data are as private and secure as they need to be, while having it be as fluid as it needs to be in order for you to get the care that you need.
So as you work the room here at HIMSS, it's quite a room with close to 40,000 people. What are the conversations you're having around this issue?
I think the most interesting thing that we're seeing now, let me take a step back. healthcare technology is like all technologies. It comes in, people have massive amounts of hype. It's going to be great, it's going to transform everything, make everybody more productive. And a couple years, 5 years sometimes goes by and it doesn't reach its goals. And the research from other industries say that two things have to happen to reach the goals. The first is the technology gets better, and we're seeing lots of examples of that. The second to me is harder and more exciting, which is what's known as reinventing the work or reimagining the work, which is the solution is probably not going to be some magical new technology. It's going to be from some smart young person coming in and saying, why do we do it this way? And the answer is, oh, because we did it that way when we were on paper and we digitized it. We couldn't figure out anything more clever to do.
Right.
And it turns out that the right answer is taking a big step back and saying, what are we trying to do here? And how do we create a workflow and work processes supported by digital that allow us to achieve new goals? I'm hearing more and more discussion about that. It's sort of people and processes first, technology then as an enabler, as opposed to coming in with technology and hyping it and saying this is the answer, because it rarely is in isolation.
And I would imagine there are really two goals ultimately. One is treatment of patients who are sick, but in a longer term sense, it's preventative care. So how do you prioritize that?
Well, it's all of that. It's basically our goal really is how do we keep people healthy, and then when they are sick, treat them in the way that provides the best outcomes at the lowest cost. And I'm confident enough of the ecosystem when I look at what's here at this conference that will sort itself out. Some of the companies will say what we're going to do is build a technology to figure out how to do better liver transplants, or take care of people in the ICU, or figure out immunotherapy for cancer. Other places and other vendors will say, what we want technology to do is help prevent disease, or improve your behavior so you eat better or you exercise more. And it turns out we need all of that. Sometimes we get magical and say, if you just got the prevention thing right, we wouldn't need the sick part of the healthcare system. The comedian Red Fox once said, health nuts are going to feel stupid one day, lying in hospitals, dying of nothing. Right. Turns out that people are going to get sick. We want to forestall that as much as possible, but we need solutions that are everything from prevention to how do we take care of people when they're really, really sick.
And who's leading this charge on improving EHR?
Well, it turns out that it's everybody. It's the EHR vendors are getting better, and their new versions are better, and they communicate with each other better than the early versions. But we're also seeing in healthcare delivery organizations a new spirit of innovation, and I think it takes a while. So at my place at the University of California, San Francisco, we're seeing some incredibly clever innovations that start from the premise that we've organized care in the wrong way. Let's figure out a new way of doing this, and then let's take the EHR and let's remodel it, let's mold it to support the innovation. So if all the innovation has to come from some of the big vendors, it'll never happen. If all the innovation has to come from Silicon Valley kind of companies, it'll never happen. It has to be those companies, the new companies entering the healthcare space, and then the provider organizations all coming together and thinking about how do we deliver care in a very different way.
Sure, and the key, of course, doctors like you who are actually on the front lines.
I think that's pretty important. I think one of the things we got wrong in the early days of the electronic health record was the companies built the tools and did not spend enough time and energy asking the doctors what they need and watching what happened when the doctors or the nurses used the tools. The classic example is alert fatigue. So if you were building an electronic health record or a digital tool, you said, here's one of the great things we can do. We can alert you if something's going wrong with your patient. Well, in my hospital last month, our computers in the intensive care units sent off 2.5 million alerts. They beeped or buzzed or did something.
And that's for how many patients?
2.5 million times for 70 ICU patients. So in a month, in 70 ICU beds, there were 2.5 million alerts. In the life of a doctor taking care of a patient on the EHR, they will get dozens of alerts a day because every time there's something wrong or that might be wrong, they get an alert. Well, what happens? 95% of those alerts are false alarms. What happens if you're human is you stop paying attention to all of them. So that's where, if you're a company, if you're an engineer, you're a computer vendor, you probably built and you say, here's a great thing I can do for you. I can build in this thing that sends out alerts when something's wrong or might be wrong. If you don't sit there and look over the shoulder of the doctor or the nurse, you'll get it wrong. If you do, you'll say, wow, I didn't expect that would happen. I better think about this thing in a very different way.
Well, that's the promise of artificial intelligence, ultimately.
That's going to be part of the answer. Yeah, that's part of the answer. What I've learned about artificial intelligence, a lot of it I've learned from my son who does baseball analytics. He's in Moneyball. And I see that what he can do with data is magical. He can tell you that this guy can't hit a lone outside curveball on Tuesday nights when the wind is out of the northwest and the pitcher is over 6'2".
Right.
I'm in an equally information-intensive business, and I can't tell you any of those things about my patients. So I think we've got a lot to learn from other industries, and one of the things that is exciting is artificial intelligence getting better really, really quickly, and the companies like Google and Microsoft and Amazon are jumping back into healthcare because they realized 10 years ago they tried and they failed because they couldn't build an electronic health record. It's too clinical, it's too complicated for them, but now that there is one, and now that there's all this data sloshing through the system, they're coming in and saying, we know how to do really cool stuff with that data. That's one of the reasons we're entering a very exciting phase.
Well, Dr. Walker, thank you for leading the charge and overseeing so much good work at the University of California, San Francisco.
Thank you, thanks for having me.
Welcome back. I told you that would be an interesting one, a very thoughtful perspective. And now we've got two more very thoughtful perspectives. I want to introduce you to two people who are part of the HIMSS family. Hank Fanberg is the 2017 Chapter Advocate of the Year, and Lauren Wiseman is the HIMSS Chapter Advocacy Roundtable Chair. So excited to be with both of you. People don't realize that, you know, just because HIMSS ends, it doesn't mean that HIMSS isn't at work, and that's really what you're focused on year-round, isn't it?
It is, indeed. Our chapter advocates are working tirelessly, working to inform, educate, and kind of empower other members of their chapters to reach out to state agencies, to reach out to state legislators, and really kind of prove the value of health information technology, or health information and technology, as we like to say it now.
Yeah, right.
And so it really is important that they tell the stories of how this affects patients, great adoption stories with clinicians, and it really reaches the states and lets them know how their money is being spent.
And from what I understand, Hank does such a good job at it that they made him Advocate of the Year.
We did indeed. He's done a great job. Louisiana as a whole has done.
Well, it's really been a great honor to be selected as the Chapter Advocate of the Year. I was nominated by our chapter president, and this has actually been a good year for the Louisiana chapter. We're one of the smaller chapters.
You have to make up for the Saints.
Well, yeah, boy, oh my God, that last play. Let's not go there.
Amazing, but
let's not relive that.
Let's celebrate what Louisiana gets right.
Yes, so Louisiana is Small Chapter of the Year this year. We won that award. Our chapter president is the Chapter of the Year Leader Award, and I received the Chapter Advocate of the Year Award. So I think it's a testament to the chapter, and even though I'm just one person, I am a member of the board of the Louisiana chapter as well as the advocacy chair, but it's the team. It's not just me, it's not just Chad, our president, but it's the entire board and the entire chapter that has worked hard all year long, year in, year out, to try to move things forward. And as we like to say in Louisiana, we're trying to improve the health of everyone, every Louisianan through health IT.
And what have been the goals of the team? And again, you were named the star, but you lead the team, and stars are because they have people behind them. What's been the goal for the past year?
Well, so from an advocacy perspective, we really focused on working with the Louisiana Department of Health and helping them figure out how can they, I want to say it's all about the data. How do we get the data? Obviously, the Department of Health, they're responsible for the Medicaid in Louisiana, and 2 years ago, Louisiana did expand the Medicaid program when a new governor came into office 2 years ago. So how do we get the data? What data do the clinicians need? Where does the data exist? How do we collate the data? How do we make that data meaningful so we can take the best care of the people that are in the program? And then how do you expand that out more towards, if it works for Medicaid, will it work for everybody else? So we act in an advisory role to the Department of Health and the CIO, the Department of Health, in helping them figure out how do they connect all the pieces and what are the priorities that they should be working on.
Lauren, it really is about public-private partnership, isn't it?
It is.
And that's what HIMSS is really all about.
It is, and it's really about volunteers. And I think Hank brings up a very good point about data. Data's great, but it has to be used in the right way. And working with public health agencies is one of the ways our advocates really make a difference. So it's not just about your representatives, it's about your state agencies, it's about local community agencies. They impact with education and knowledge with that in several areas.
How do you deal, one of you jump in here, open-ended question. How do you deal with the fact that when you're dealing with state agencies, there can be turnover every 4 years? I mean, how does that affect your own work process?
That's a great question. It's really a matter of, so I think part of it is, well, it's relationship building. And usually, it's the political appointees that will turn over. So the Secretary of Health at the state level. And I think it's a parallel in federal government also, where the House of Representatives every 2 years, they're up for re-election and they could turn over. But the staff usually stays in place. So the people that run the agency day to day, they're usually there. So it's not just working with the leadership, the secretary, but working with the people that are actually responsible for coming up with how they're going to do the work, what has to get done, how do you go about implementing it. So being able to work with people at that level is very important also, but obviously the political leadership is going to be very important to have a relationship with them also. And what I like to say, the nice thing about HIMSS is that we are a neutral party. We don't take sides.
You're looking out for the patient and furthering technology.
Right, exactly. We're looking for better healthcare through health IT. So we're not concerned about partisanship. It's about how do we make the people better.
And it's a very good point about staff. We make that point to the advocates, the new advocates and established advocates. Those are the people who are doing the research. They're doing a lot of the work for representatives, for agencies, and they're excellent connections. And as Hank said, that's a relationship that we really value and try to sustain.
Has the strategy or messaging changed coming from HIMSS to the various governments as a result of political change in Washington last year?
I don't think so, because we're bipartisan. I mean, health information is a need that everyone has. It's not something that only a certain segment of the population needs.
Have you had to go about it differently? In other words, you know where you want to go, but do you have to maybe do it differently?
I don't know if it's differently as much as understanding the priorities of the new administration and what they want to accomplish, whether it's federal, whether it's state level, and making sure that we can address that. So, like again, Louisiana, new governor came in 2 years ago, and up until then, we did not participate in the ACA or expanding Medicaid, and he decided that that was a priority for Louisiana. So understanding that, then, how do we then advocate what can health IT do to help with these new people that are going to now be eligible for Medicaid? And are there ways that we can help support that? So we're taking what their priorities are, because ultimately it's really about the same thing, about giving access to people. The financial piece of it is always an issue. Louisiana has a budget issue this year, and actually the special session just ended, and the last week, and regular session just started yesterday. So it's understanding their priorities and how do we fit what we can do into their priorities.
How much of the time do you spend in the Capitol itself?
Not that much, really. But it's not one person. It's not just me.
Sure, it's a team.
And so we're all volunteers. We all have day jobs, and we have to show up to our day job once in a while. But it's not just me. It's not just Lauren. We particularly with advocacy, everyone and anyone can be an advocate. So it's a matter of communicating out and getting the entire chapter to understand what our priorities are, and getting them to contact their elected officials as well with the message that health IT can help do this. So let's keep that in mind as you're in your discussions and your sessions in the Capitol.
We educate not only representatives but our members and our boards around advocacy issues, and we get a lot of help from HIMSS National and the government affairs teams that have really been a strong resource for us. But no, we're not in the capitals that much, but a lot of the officials have local offices, and that's where it's most important to be.
It's on the ground, in the trenches. It's almost person to person, isn't it?
Right. Exactly.
Yeah. Well, and a lot of it, as Lauren said, really is about education. We're not, we are not lobbyists, but we're educating them what we can do with health IT. And I work for a large Catholic health system, So everyone comes with their own perspective. To me, that's one of the really nice things about HIMSS, is that it encompasses the entire industry. So it's the vendors that we use, the EMR vendors, all the other, the 1,300 exhibitors in the exhibit hall here, that we use the things that they develop, and we can go and tell them from our perspective what's working in care delivery. Lauren runs an HIE, and that's a little bit different. They're connecting all the players together, but ultimately it's about the same thing, being able to connect the data, get the data to where it needs to go so we can have better health outcomes.
Exactly.
And for people who are listening, are passionate, and want to get involved with a local chapter, how do they do it?
Well, all of the chapters have their own websites, so you can go to HIMSS.org and find any chapter, and you can contact one of the chapter leaders and become involved. I mean, we'd love to have more younger people involved.
Sure.
I mean, Hank and I are on the, we've been doing this
Pass the
for a
baton.
while. But you know, it's so meaningful. I think I've gained so much from being part of this effort, more than I've given. But we'd like to see younger folks involved as well. We want to bring up that new generation.
Of course, yeah. I'm part of that silver tsunami that Eric Schmidt
silver tsunami
Wolf was talking about yesterday in the opening session.
Yeah,
I have the hair to prove it.
I'll be getting more silver by you know, whatever the years, I guess.
Yes, yes.
It happens.
Yeah,
all right. Well, Lauren, thank you so much for just
welcome.
helping us understand all the good work that HIMSS does when the conference ends. And Hank, congratulations.
Thank you so much
on winning the best in the country.
Advocate of the year. Yes, it's an honor, and it's the team. It's not just me. It's the team.
Understood. All right. So talk about teamwork. You may not realize that Lenovo Health and Intel have actually teamed up together. They're working on some fascinating IT innovations that elevate delivery care. So the two representatives, Ashley Rodrigue and Casey Sutton of the Lenovo Intel partnership.
So the vPro brand is really this umbrella that gives IT professionals this peace of mind when they buy that brand. And what it means is there's all sorts of different features and functionality within that vPro brand that deliver real value. So for example, you would have the ability to remotely activate, manage, secure, and keep track of these devices at the edge using active management technology from Intel. So this is really great for reducing operational costs and creating efficiencies for those IT professionals. And they're using these platforms that are already using today. So they're very familiar with how to use them and the tools that are used to remotely manage these devices. Furthermore, within that umbrella, you sort of get this long roadmap, 15 to 18 months of stability with our stable image platform. So what this does is it really gives the IT professionals this frame of mind and ability to know that when they buy that vPro brand, they have all of those things under that umbrella.
And then from a Lenovo hardware perspective, I think one of the beautiful things is we're able to offer that manageability with vPro processors and the whole gamut of our ThinkPad, ThinkCenter, and ThinkStation lineup. But we're bringing that kind of technology in a way that's really meaningful and helpful in that healthcare setting, right? The right types of technology in the right places really can streamline a workflow. They can help promote a good and meaningful patient interaction. And at the heart and soul of it, it can make sure that you have quick, easy access to the critical information you need. So when you look at something like our tiny desktop and tiny in one monitor, there's a time and a place, whether that's at a nurse's station or maybe that's at check-in or maybe it's actually at the patient bedside, where this kind of device really can be a game changer. And having that combined with vPro technology really is what makes it an excellent solution in the healthcare space.
So remote secure erase is a really great feature that's available on Lenovo self-encrypting drives that allows you to remotely secure and erase an entire hard drive if you should realize that that PC has come into the wrong hands or potentially is lost. So this gives the IT professionals a lot of control to remotely manage and take care of any sort of security issue before it arises.
When it comes to Lenovo, because we have so many amazing devices that feature those vPro capabilities that give you, you know, the options to consider things like remote secure erase and manageability, it really goes a long way. And so we really like to embrace everything that Intel brings to the table with their products and with vPro especially. But then we always like to take it a bit further. And sometimes it's with security solutions that are a little bit more simple but really powerful, like our actual Think Shutter this year that's a little privacy slide over your camera, and some of them are a little bit more advanced, like taking technologies like Windows Hello and pairing it with our match-on-chip fingerprint readers, or even our glance technology that helps you take locking down infrared camera login and sign out to the next level. So it's really our philosophy is to embrace and extend and make sure that we're offering as secure and manageable a solution as possible.
So one of the great things that we've done this year in the vPro platform is that we're actually delivering fantastic performance. We're talking our very first 15-watt quad-core processor, which is up to 31% more efficient than 7th gen Core. This is phenomenal, and when it comes to being able to put that into different form factors and really sort of take advantage of that performance as an end user, you really notice the difference.
Yeah. And let me tell you what that means for the Lenovo Health lineup this year. When you look at our ThinkPad lineup, for example, you've now got all of the power and performance of quad-core processing, but in ultra-portable form factors. Like even something like our X1 tablet. This is a 1.9-pound tablet that now features quad-core processing capabilities. This is the kind of device, this or even one of our Yoga convertible 2-in-1 devices, that really allow you to bring patient engagement to the next level and really talk about incredible ways to work with our patients and to work with and collaborate with our own other clinicians in the workspace today. So I think that's a really powerful story when you think about bringing all of that power and performance to really incredible form factors with the ThinkPad lineup. Now, I think that's about all we have time for today. So thank you guys for taking the time to listen. And if you want to find out more, don't be shy. Come on down and see us at the Lenovo booth 2443, and you can always find out more from us and also our friends at Intel by checking out our website, www.lenovo.com/health.
All right, I promise you we are about to have some fun right here with Matthew Holt. He is co-chairman of Health 2.0, a series of conferences that you yourself described as the anti-HIMSS, and then HIMSS went out and bought you.
Well, something like that, Adam. Yes, we got to say that exactly. I hope we have to scrub that part. Perhaps,
no, it's all good.
Hopefully Hal isn't watching this part. We'll see.
But what's interesting about Health 2.0 is you typically focused on sort of the smaller stuff, the social, the mobile phone, the stuff like that, as opposed to HIMSS, which is more enterprise. In other words, IT across a whole company.
Yeah, well, so the interesting thing is that that's all changing, right? So if you think about it, we started this back in 2007, before there was an iPhone, before there was an app store. People were trying to figure out, could they put applications that patients can use on the web? Slowly, could we start using the things that were coming out in regular life, like Skype, to communicate between doctors and patients? So all that was just sort of getting going. And what we've seen since in parallel is HIMSS has been, benefiting and hosting and helping the growth of the EMR enterprise side over the years, obviously with high tech and meaningful use. Meanwhile, there's been a parallel set of investment from venture capitalists in earlier stage startups, now ranging up to, I'm doing a panel on this tomorrow, about $8 billion, depending who you believe, spent in last year in venture capital investment.
Over what time period? 8 billion?
A year.
A year?
A year. Last year, about 8 billion spent, depending. Some people say 11, some people say 6.
Sure.
Some in the middle about that. Invested in relatively early stage startups, but some of them are very big numbers, and some of them are actually now quite large companies. What's going on there is the transition that we've seen in the rest of society to the cloud, the Google, Facebook, Apple phenomenon is now going to start to come to healthcare. We very much represent that part of the world in health technology, and so bringing that together with HIMSS, bringing Health 2.0 and HIMSS together is as natural as bringing that type of technology together with enterprise technology, which you're seeing right now.
If I were running Google, I think I would hire you as my deal guy, my banker, and say, go find me the ones that I should be buying.
I'm highly surprised that they haven't done that. Well, to be fair, do a little bit of that. So
of course.
Yeah, of course.
That's part of the deal. In fact, I would imagine coming to HIMSS, being part of it, leading some of these breakout panels. that's a huge opportunity, right, to find out the sort of the new kids on the block and who's doing it.
Yeah, we have a thing called Venture Connect that's happening tomorrow, and it's actually a contest in that, where there are 6 companies that won. I think 6 out of more than 100 have applied to be judged by venture capitalists. So you're seeing a lot of activity in the early stage startup. I do a lot of work with pre-seed and early seed startups, then startups who raised $2 to $12 million. Then you have several who've raised 50 to 100 to 200 and several more than that. So a lot of activity. There are about, we calculate around about 5,000 companies somewhere in the sort of the new technology space that's in the IT world.
And that's just US or is that global?
That's probably global. Some people say it's a few more.
Okay.
But the interesting thing is that we used to make a hard divide between IT type companies and medical device and biotech and genetic stuff, and that line is all blurring very much as you're seeing, the phone becoming a hub for sensor information and much more, patient monitoring on the wrist and elsewhere. So it's becoming a very complex world. And we've had Hal Wolf has been saying that the goal of HIMSS is now to start reaching out to be dealing with patients in the home, and dealing with consumers. And that's really where healthcare has not been before and is now going to have to start going.
Yeah, right. Telemedicine is one of the things I keep hearing about here. You mentioned phone, which is why I ask you. Where are we in that whole process of somehow letting the phone be the, the gateway for the doctor-patient relationship?
Much closer than we've been for a while, much closer than you think. So when we started doing this, people started to use Skype, and there were some early stage doctors doing psychiatric evaluations and what have you. You've now got a bunch of recognizable companies, some of the leaders like American Well, MD Live, Doctors on Demand, Teladoc, who are now established companies working with employers or insurers or big players like Walgreens or CVS. So, and you've now, depending again on who you believe, you're now seeing upwards of 20+% of consumers having actually had a video visit. I've had myself, I think I've had more video visits with regular doctors in the last 3 years than I've had regular visits, and hell, a lot easier, cheaper, more convenient. And I think the more you see that spread, the technology is now ready for that. So in some ways, it's almost yesterday's news. It's like, what do you layer over that?
Tell me what I don't already know, right?
Maybe.
Yeah, fascinating. Your next session that you're leading is when?
Tomorrow morning at 8:30, I'm leading the introductory panel on investment at the Venture Connect Forum, and then I'm on a panel sometime Wednesday afternoon. I have to check exactly around innovation competitions and startup contests as a way to get publicity for new technologies. So
love it.
I'll be looking forward to that, and I'll be touring around the HIMSS show floor like I usually do, chatting with people. I do my own interviews. I have my own little TV show.
Oh, do you really?
So
how do we find that?
So I put it on the blog, the healthcare blog, which I've always owned for these years. It's a little fun little thing called Health in 2.00, where Jessica DeMassa asked me as many questions as she can ask in 2 minutes, and I try to answer it. We did it last night in the bar in the Venetian, so bit of a crazy one, but it was fun.
Love it. Before I let you go, you have a thing, and I don't know if we can get the camera to zoom in. You have a little pin.
Oh, my little pin.
The
pink, just there, the pink sock.
The pink pin with a mustache on it, yes, or a moustache if you prefer. What does that signify?
Well, if you wander around HIMSS, you'll find probably a couple of 100 people who are wearing pink socks, literally pink socks.
Yeah, literally pink socks. Yeah.
And started by a guy called Nick Atkins, who's a crazy man you should have on this show.
Right.
And it kind of means I'm here to be aware that I'm trying to make change in healthcare, but also to be nice and give you a hug. So I've never quite, which we need a lot more of that in healthcare, right?
Exactly.
So Nick has, I believe, given away 20,000 pairs of pink socks, and I only have a couple of pairs. And now I'm a grown-up. I have to change my socks every day.
Yeah, right.
But today I don't have the pink socks on, but I do have the little.
Excellent.
Little
so
thing.
what it does is effectively telegraph to people around HIMSS that you're open to ideas. You want to make a difference. Come talk to me. And let's
it's
make
a
it
little
happen.
conversation breaker, and I think it means whatever you want it to mean. But I kind of think that healthcare needs a few more people to be open, be friendly, and to give you a hug. So yeah.
Well, we all do. All right, Matthew.
Great pleasure.
Thank you. What a pleasure. All right. Our next guest is someone you might not expect to meet at HIMSS, but I'm so glad he's here. Geir Renwick. He is Vice President of Business at Lyft. That's right, the guys who actually pick you up in a car. What are you doing here, Geyer?
Yeah, well, thank you for having me here.
Thanks for being here.
Great to see the pink mustache spread across the floor as well.
Well, I originally thought it was a,
That's what I was hoping for as well,
exactly.
too. So I actually lead the healthcare team at Lyft, which is a team that we created, or I created 2.5 years ago when I actually joined the company. So I actually was at Google before this doing healthcare partnerships and joined Lyft originally actually to try to solve one of the fundamental problems in healthcare is transportation. How do we help individuals get to appointments in a more reliable manner? And really, transportation is the beginning of the continuum of care, and we're looking to try to solve some of the challenges that exist in that area.
In other words, you are 72, you're living alone, you need to get to the doctor. How do you get there?
Yeah, so our first population we targeted was actually Medicaid and Medicare, because we looked at those individuals were challenged where they didn't have a smartphone, they didn't have the means to pay for Lyft themselves, and we wanted to really solve that challenge. Today, 3.5 million patients miss appointments every year due to lack of transportation, and we think the solutions we're bringing to market, by the next 2 years, we think we can cut that number in half.
So how does it work? I'm on Medicare or Medicaid, I need help getting to the doctor.
Yeah, so over the past 2.5 years, we've partnered with really every piece of the ecosystem of healthcare. We've partnered with payers, we've partnered with health systems, we've partnered with technology solutions, and also transportation brokers. And so what we're doing is we're taking transportation and putting it in the hands of the caregivers. They're the ones paying for the rides, they're the ones calling it on behalf of the patients, so the individual has the benefit of transportation with never actually having to call it themselves or paying the bill for that ride.
So a doctor's office is actually booking the car?
Yeah, so we've given them tools built specifically for healthcare that allows them to call rides on demand or scheduled in advance, and then manage those rides real time and actually see where their patients are at all times.
And then how does the doctor get reimbursed?
So the doctor is either coming through Medicaid or Medicare, which is paid for by the government for those rides. The other interesting thing is health systems are looking at it as an operational cost for them to drive efficiency for their systems. If you think about if a patient's ready to go home, it's preventative. It helps them drive efficiency of people showing up to those appointments, and also it drives efficiency of helping individuals go home after those appointments are finished.
I mean, it's brilliant, it's so simple, so obvious, but I don't know, we didn't do it for so long. How'd this whole thing come together?
So this was my idea. So I joined Lyft really with the business
This is your
plan.
baby.
This was my baby 2.5 years ago.
Well done.
So
Good man.
Thank you, I appreciate it. So it was an idea that I felt like was a problem to solve. Google was getting into autonomous vehicles, looking at transporting people that were blind, disabled, or elderly, really small scale, and I really became passionate about that space and saw the use case that was there. Came to Lyft, basically put together a business plan and said, you should hire me and you should let me build out a team. 2.5 years later now, we have partnerships with 9 of the top 10 health systems, 10 out of 10 transportation brokers, some of the largest health plans in the country, and then even this week we announced a partnership with Allscripts, which was the first time we're actually integrating directly into an EHR to drive that much more efficiency. So a provider now can actually call Lyft without ever leaving the workflow they're using today.
So you mentioned transportation broker. That's not something, I can understand why it would exist, but it's not something I've ever heard of. What is that?
So transportation brokers actually manage the transportation benefit for those on Medicaid and Medicare Advantage. So when an individual is on Medicaid, instead of going directly to the health plan, the transportation brokers manage that benefit on behalf of the patients. So a patient was calling the transportation broker, and now all 10 of the top brokers partner with Lyft to provide that transportation benefit to those members. So it drives efficiency, it's cost savings, and it's a better experience for the actual member.
Are there any limits, like, for example, if someone lives in a rural area 20 miles from a doctor or 40 miles from a doctor, that can get expensive?
It can. So Lyft's coverage today is 95% of America's population. So we really have addressed some of those rural areas that exist there. If you look at the providers they were using before, our cost savings are 30 to sometimes 50% more affordable than they're using before. So even for those long haul trips, we're actually providing cost savings to those benefits. The other piece that's interesting is in Medicaid, a significant challenge with fraud, waste, and abuse. The kind of accountability of those trips that happen. We provide a digital footprint of those trips and actual accurate recording of where those trips occurred.
You know, this is going to sound trite, but it's a great illustration of your last point. A friend of mine in the city who owns a number of McDonald's where everything is automated also owns a number of Irish bars back in New York City. What he found was that when he put everything on a digital platform, no longer cash, fraud went out the door.
Absolutely, and that's the challenge we'd love to be able to solve. We think that we can cut costs by being a more affordable option, but we can also, we think, cut 30% of that savings for Medicaid and Medicare as well. So it's exciting.
And maybe save some lives in the process.
Yeah, and the interesting piece is we think longer term, adding transportation as a benefit can not only lower costs for the payers, but we actually improve health outcomes. And that's what we're really excited about, is ultimately trying to solve that problem and providing a better experience for our patients.
Wow, just fascinating. Is anybody else doing this?
So we were the first one to the space. Like I said, we've been doing this for 2.5 years. There's other players that have got into it. Again, our approach has really been to focus on the entire ecosystem. So really, again, focus on all quadrants of that. The relationships we have now really position us well to actually leverage those relationships to really solve this challenge together. So again, the Allscripts announcement is exciting because we're partnering with Allscripts, who works with Ascension, another one of our partners, to actually bring all these solutions together, as well as some of the top payers like Blue Cross Blue Shield. So we think we're well positioned really to bring this market together, and again, over the next 2 years, we think we can solve a significant challenge that exists.
All right, Geir, thank you so much.
Thank you, I appreciate it.
All right, a fascinating conversation here at HIMSS, and I've got another one for you. Reed, you have a massive job running the healthcare business for HP. Describe what that means.
So we really look across all of HP's portfolio, across personal systems, print, services, and even into our new 3D business, and look at really kind of slice across that portfolio and think about how it works in healthcare. What kinds of things can we do in healthcare to make those programs really work better, deliver better products for the provider space.
So if I walk into an operating room, an emergency room, I'm going to see not just a regular HP PC, but a very specialized one.
Yeah,
what makes those units different?
In those environments, we find that there's an extra set of needs. At the point of care, we have challenges in the industry right now around things like hospital-acquired infections. We're looking at overall quality. We're trying to figure out how do we help physicians to be much more efficient in how they're accessing data, how are they getting into the machines. And so what we've announced today as part of our Healthcare Edition portfolio launch is a series of products which are safer, smarter, and secured for healthcare. Safer being from a sanitization and electromagnetic interference and safety perspective.
So in other words, I touch the key with a glove, there's blood on the glove, but somehow
I'm able to actually sanitize the device, clean it fully, which is not something that's been out there by standard. The chemicals that we use for chemical sanitization in healthcare are incredibly caustic. They're very strong chemicals built to be able to kill off.
They're not good for you. They're meant to kill.
Exactly, they're meant to kill bugs, and so at the end of the day, they're not necessarily good for general compute hardware. So we built our new set of products from the ground up, designed with new materials, new coatings, new plays, to be able to actually make them fully sanitizable. You can clean them with all the chemicals we have in healthcare, and fully sanitize them. They're also smarter. From a smarter perspective, we think about things like workflow efficiency. How do we help doctors to be more efficient? How do they get access to their desktops better? How do we improve telemedicine sessions? How do we make it so that they, when a doc and a nurse are having a conversation with a patient, how do we make that interaction better? Right. The environments are not always the same. They're not always consistent. How do we make it so that it's a better interaction with that patient? And then the last piece is really around secured for healthcare. And making sure that it is the most secured platform in healthcare. We see a tremendous amount of growth in the attempts at actually going after healthcare data. It's one of the most valuable data points in the world. So those threats are not going down. So being able to secure that platform is big.
I'm glad you said that. That's one of the themes I've noticed talking to people. Everyone this year is talking about security. Why do you think this year more than in years past?
I think we had more visibility of it than in years past. If you look at WannaCry, if you look at the way that many of our major healthcare providers around the world have been impacted by malware, by this growth, that's not going away. It's just going to continue to accelerate and grow. So being able to make sure that we have a secure platform has been always a focus. We think about things like firewalls, we think about enterprise level security and being able to keep the bad guys out. The reality is we have real challenges at the endpoints, and being able to make sure that those endpoints are more secure and hardened is really the key, because we can't protect ourselves from users in a lot of cases, so we have to make sure that we build a platform that actually is more secure for our patients and physicians to be able to interact with.
And was this a collaborative effort, working with doctors, working with hospitals, working with all the people who are actually using the equipment?
Absolutely. Yeah, HP, we develop all of our products with really deep insights across the portfolio. We very specifically work with the industry to be able to look at our products and figure out, what kinds of things do we need. So our Healthcare Edition products were designed very specifically with our healthcare advisory councils, customers around the world that have really impacted that design and driven a lot of what we do.
And for people who, hospitals, doctors, et cetera, are going to be buying this new hardware, investing in this new equipment, this is geared for what kind of life cycle? 5 years, 7 years, 10 years?
Yeah, you know, the life cycle is different for each organization. What we actually see is a shift in play right now where we're seeing the acquisition model for healthcare customers is changing. You know, technology is advancing at a very rapid rate. We're seeing life cycles really change. So we're actually seeing a shift where organizations are starting to even look at, instead of buying for the long haul and doing a 7-year life cycle, starting to look at a services model and saying, hey, look, the next time this product meaningfully revs and becomes something that I need or has another advancement that I really need for my organization, having the services platform or the devices as a service plan alongside of it to be able to now rev that product and secure a new one without having to go through an entire re-life cycle or that kind of work. It's been pretty interesting, the shift in terms of how the industry is shifting for acquisition of product.
Well, can you lease the equipment now?
Yeah, being able to buy it as a service means things like per device, per month types of acquisition. So you know, being able to have kind of across the board for supporting any way that customers need to buy their product.
You know, Apple let the cat out of the bag with the iPhone, right? You can lease the iPhone, get a new one in 2 years, and I guess it's happening in the operating room as well.
Same thing, yeah. And across the healthcare portfolio, being able to do it at, you know, whatever the right term is for the organization. But I think the other thing that we did is, instead of just saying, hey, here's your device, being able to wrap it with services, wrap it with software, wrap it with meaningful components that help us in the industry with patient engagement or population health portfolios, or being able to just start to include the elements that we need to be able to drive better telemedicine platforms or better security portfolio products, those kinds of things. So really changing how folks acquire. It's not just, you know, go buy 5 different things. It's, if I do this one and I can put that on a single service that revs, it makes it a lot easier for our customers to be able to acquire technology.
Well, congratulations on the new launch, taking all this new equipment into the OR and keeping people safe.
Thank you very much. We really appreciate it.
Thanks, Reed. How'd that feel? We have a lot happening here at HIMSS. So I tell you what, we're going to go to Carrie Christensen. She is Director of Research and Innovation at the National Committee for Quality Assurance. She and I had an opportunity to speak yesterday, and here's what she's told us. Carrie, I feel like I should call you the professor, because you run education here at HIMSS. How do you prioritize? Hundreds of people are going to get up and talk.
That is a great question. So we have a group of a dozen or so volunteers that work with HIMSS, and we look at every single submission for an educational session, which is 1,000. And
for how many spots?
For a couple of hundred. It's very,
tough.
Yeah, it's a very competitive to get your presentation in. So we really get very high quality, very high caliber speakers, which makes it a great conference.
Well, and this is a passion for you, isn't it?
Yeah, so I've been a reviewer for, I don't know, maybe 10 years, and have always loved getting to read all of the different presentations, all of the creative ideas that come in that want to come spread their news and their information to their colleagues at HIMSS. And then I got to be on the committee last year, and then this year I'm chairing the education committee. So it's all up to our team to make sure that everything goes really well.
So it's impossible for everyone to hear all these different presentations. What's your advice for people who are trying to prioritize and figure out which of these educational sessions to go to?
Great question. So I think the really unique thing about HIMSS is that there is something here for everybody. There's probably not even one session that everybody who comes would be interested in. But whether you're interested in security or hardware or usability or my personal passion, the social determinants of health, you really do have...
The social determinants of health?
Yeah.
Tell me more.
Yeah, so social determinants of health is things that affect your healthcare outcomes that are based on the rest of your life outside of medical care. Yeah, so things like food insecurity or transportation issues, all of those affect it, and it's one of our new tracks this year at HIMSS, so I'm really excited to go to all of those sessions.
So how do you even begin to address that? I mean, it's hard, right? It's like, you know, is it diet? Is it
That's a great question.
People you spend your time with? I mean, on and on, you know?
Yeah, so the way that it plays out here at HIMSS is how we collect that information from patients and then how we help connect them back to organizations that can address those needs with them.
you're getting to one of the other themes that I keep hearing from our experts, and that is it's all about personal data, collecting that data and then somehow making sense of it.
Yeah, there's so much information out there that we really need to be able to take all of it and turn it into a story so that clinicians and other providers can help us take care of our own health and understand what our personal story is.
Right, so it's preventative. All right, in addition to that particular angle, the environment that we live in and how that impacts our healthcare, what are some of the other educational themes that people are going to hear this week?
Great question. I think one of the really interesting things out there right now is security and privacy, and we've got a ton of sessions on that as we do every year. But like I said, it really is everybody's unique needs, whether they're coming from a small hospital in a rural setting or they're a tech guru from a cutting edge company. There's some education that's really tailored right for them, and it's really easy to find because on the app you can actually search by track and see everything that you might be interested based on that particular topic.
And how many of these sessions are actually recorded, or were there notes or a flip book or something, so that if you miss it, you might be able to, you know, go back and get it?
I know personally, I was helping my team figure out what sessions we wanted to go to, and one of the great things about the application is the slides are right there in the application. Perfect. So you can preview the session and make sure that it's really targeted to what you're interested in learning.
Or if you missed it, you can go back.
Absolutely.
All right, and before we let you go, when not at HIMSS, tell us what you do, because I know that's another passion within healthcare.
So I work at the National Committee for Quality Assurance. We're not-for-profit. We help figure out the best quality for health plans as well as patient-centered medical homes. And I work in the research and innovation department.
Which explains why you're running education here at HIMSS.
Yeah, it's always exciting, something new.
Love it. Carrie Christensen, Chair of the Education Committee here at HIMSS, thank you.
Thank you.
All right. All right, welcome back. I just want to let all of you know that if you are watching online, you're probably best off using either Firefox or Chrome as your browser. I mean, you can watch this anywhere, but I just want to make sure that you get the fastest, best feed possible because there's just so much coming at you. And you're going to want to fasten your seatbelts for this one. Greg Johnson is joining us. He is the Chief Clinical Integration Officer at Parkview Health. And what we're really talking about is how to cut the fat, get appropriate care for people, and make sure that everyone gets paid.
Just like that. Just like that, in 5 minutes.
Yeah.
So the talk yesterday, or the presentation yesterday, was about patient engagement and how it's important. Without patient engagement, the likelihood of success in the value-based world, or what we call the alternative payment universe, it markedly reduce your likelihood of success. And so we talked about patient engagement, and probably the biggest message that was delivered, I believe, was, are you willing and able, as a provider, a health system, a hospital, are you willing and able to put your best foot forward as it relates to patient engagement? Because often we look at, if a patient's not engaged, it's their issue.
Right.
And that's not true.
Not always the case.
Right. In fact, are we doing all we can to engage patients? Are we meeting them where they are? Are we giving them the information that they desire? Not the information that we want to give them, but are we giving them information that they actually find valuable and they're desiring? And it's a little strong, but getting away from the paternal aspect of medicine, right? And saying, I tell you what to do as a doctor and you go do it.
Right.
That's often, we use the term non-compliance, and I think that's a scary word.
Because the patient doesn't do what he or she is told to do by the doctor.
And it's easy to label you as a non-compliant patient, because then I'm not accountable for your success.
Sure.
So really
or failure, right? Oh, he didn't do, or she didn't do what we said.
And so it's really important that we as health systems, providers, that we're doing all we can to engage that patient. And we're accountable when we give a patient a care plan.
Yeah, right.
It's not about just handing it to them and saying good luck. It's about meeting them where they are and help them to execute. Because an average care plan executed well is wonderful. A brilliant care plan, not executed,
poorly executed, right. So what fascinates me about what you're trying to do is sort of, I feel like it's where we all want to go, we don't know how to get there. To cut out unnecessary procedures, which means doctors on the one hand aren't going to be paid, or hospitals, et cetera, as much because there weren't as many, procedures that they can get reimbursed for, and yet somehow create an incentive that's linked to the patient's health so that they do ultimately get paid. I mean, how do you even do that?
So in the value world, you got to have quality outcomes. Right. That goes without saying. And where you can begin to offset those is in a value-based world where you're getting, if you can take care of a patient for a lower cost, total cost, sharing in those savings with payers or CMS, sharing in those savings with the provider can offset some of that. What I'll say, and I'll speak as a physician here, what I'll say is that most doctors don't want to do something that's inappropriate. Right. So a
they have taken an oath, right?
But readmissions, for example, readmissions, the reason that's awfully wasteful. If I just admitted you to the hospital and took great care of you for 6 or 7 days, for 4 or 5 days, better length of stay, and you get readmitted 7 days, 10 days later, I didn't really do my job. I may have taken great care of you during that hospital stay, but then we have a tendency to discharge patients, right? When you discharge from the hospital, well, we try not to talk about discharge anymore. We talk about transitioning. So what am I doing, again, to partner with that patient in that care plan to transition into whether they're going home, whether they're going to a skilled nursing facility, et cetera.
And by the way, is there some sort of benchmark so that, in other words, we'll never really know if we hadn't, done it differently. Is there a benchmark that you can use?
Well, the benchmark is what does it actually cost to take care of a patient now? Right. So that's your benchmark. And if you can begin to reduce inappropriate utilization and waste, then obviously you should be able to do that at a better cost, and thus that drives value up further.
Yeah, it certainly does. How many other entities are focused on what you're trying to do to shift to this value-based medicine?
I think everybody has it in the back of their mind, and everybody's at different stages. It's very market dependent. It requires a significant infrastructure investment from a health systems perspective. Being a clinically integrated health system gives us more opportunity to do that than if I was a hospital provider solely. But I think it's on everybody's mind, and I think you could find health systems that are at one far end of the spectrum, but you can also find providers and health systems at the other end where they're not where they probably should be.
Yeah, right. Well, Greg Johnson, thank you so much for being here and just opening all of our eyes.
Thank you.
All right. Wonderful to see you.
Yeah.
All right, so I tell you what, we're now joined by Stephen Curran. He is in the Office of the Assistant Secretary for Preparedness and Response. That would be the Office of Emergency Management. What a pleasure to have you.
Good morning.
When they said that you were going to be coming on today, I said, oh wow, we've got a FEMA guy coming on. That's a big deal.
Well, FEMA guy would be a big deal, but you have an HHS guy here.
Well, but it's the same ballpark.
Yes.
Describe your mission, what you do each day when you walk into your office.
Certainly. I'll first talk about our office. The Office of the Assistant Secretary for Preparedness and Response has been around since about 2006. Was created to coordinate all of the health and medical emergency response functions within Department of Health and Human Services. You mentioned FEMA. FEMA, of course, coordinates the national response to all emergencies. Underneath that, HHS has responsibility for coordinating the health and medical piece of it. So we have a program within that office to work with private sector partners to help the healthcare industry prepare themselves for any emergency they may face. Now, that could be a hurricane or a flood, the hurricanes we saw last year in 2017. Increasingly, though, incidents that are impacting healthcare and causing a significant disruption to services are cyber incidents, are incidents looking at or infecting our electronic health records, our medical devices, and potentially causing even greater disruption than they have already. So we're there to work with industry to help them understand the threats as we see them, to hear their feedback on what best practices are out there, and to together help protect that industry.
All right, so I'm going to go a little left field on you here.
Sure.
I've just bought my first cryptocurrency.
Yes.
And I was told that I should put it in cold storage rather than have it on my computer. In other words, put it on a zip drive and take it off. Why can't we effectively do the same thing with health records and keep them safe?
It's a very complex issue, and there are so many interconnected systems that we use. I won't make any recommendations about cryptocurrency investing. That's something that people can do
use your help.
at their own whim. But in healthcare, as you know, we have so many different organizations. We have large integrated healthcare systems. We have small clinical practices. We have so many different systems within those individual providers, from their electronic health records to their medical devices to their administrative systems, even their building control systems. Everything is now interlinked, and a vulnerability in any one piece of that can lead to a vulnerability throughout the whole system. So that's the challenge we face, and it's something that really will take a long-term solution to look at.
What are we doing well? And then my follow-up's going to be, and what are we not doing well?
I think what we're doing well across healthcare is recognizing the problem. It hit us very hard in the last few years, in the face.
And by the way, it's not just healthcare. I mean, JP Morgan, Home Depot, Equifax, on and on and on.
That's right. And in many ways, we were a little bit later to the party than others. And some of the ransomware attacks that we now face in healthcare were hitting the retail sector and banking and finance several years earlier. But now, no one's immune. All sectors are being hit. And more recently, I think healthcare has become a major target of those attacks. So I think, though, as it's happened, we have had industry that's responded and recognized very quickly that really there was a flip of the switch almost, where healthcare, we were suffering some attacks, we had issues on cybersecurity, but ever since about 2014, the escalation has been significant. So we've woken up, we've seen this as an issue, we want to work together. I think also the appetite in industry and in government to work together to solve or at least address these issues is really present. Across HHS, we have tremendous interest from the leadership of our department to all the different operating and staff divisions to make a unified effort to work on this issue. And across industry, we're seeing increasing organization, companies coming together, recognizing a shared problem and working to address it.
So now the hard question, what are we not doing well, or where we need to just put some more effort?
There's a lot of work out there to be done, and that's a good thing. We all have things that we can, roles we can play. Every single person in a healthcare environment has a role to play in cybersecurity. The roadmap that we're basing our work on is the Healthcare Industry Cybersecurity Task Force report. So in 2015, under the Cybersecurity Act, HHS was tasked to convene a task force of subject matter experts from within government, but more importantly within industry. So the predominant number of our members of that task force were industry partners, 17 of the 21, and they worked for a year to get the best input they could from healthcare, from other sectors, experts who are dealing with these problems, security companies, and came out with a report in June of 2017. Provides 104 recommendations across industry, across government, across Congress. So it's going to be a long-term solution. That's a lot to work through. We have strong momentum both at HHS. We're improving our information sharing ability, our analysis of cyber threat information. We're improving our partnerships. And on the industry side, they are self-organizing, creating work groups to work through many of these issues at an industry level.
I would think this is actually one of the few things everyone can agree on, right? It's got to be safe.
I think so. I think so.
Yeah.
It's cybersecurity, as healthcare providers, healthcare professionals, everyone involved in healthcare IT professionals, we're all healthcare professionals, and our obligation, our duty, and I think what should give us inspiration in what we do is our protecting our patients, and we protect our patients through strong security practices.
Are you leading some of the conferences here this week?
Yes, we have a session actually take place in about an hour, so if those are watching beforehand, it's Delfino 4002. I can't tell you how to get there, but I will be there, along with Beth Galoran, who's the Chief Information Officer at HHS. We'll be leading a panel discussing all of these activities, especially how we're implementing the Cybersecurity Task Force report. The government co-chair, Marie Shulak from CMS of the task force, will be there presenting. I'll be presenting. We have a private sector partner who will be talking about industry efforts. So it'd be a great opportunity, I think, to learn about the current work going on at HHS and outside.
Boy, I'll say, well, you're up in an hour. I'll let you go. You can go grab a quick sandwich, and good luck.
Thank you very much. Appreciate it.
Oh, thanks for being here. All right. Warren Williams is the branch chief, Immunization Information Systems Support Branch, that is, for the National Center for Immunization and Respiratory Diseases, the CDC. So, Warren, thank you for being with us.
Pleasure. Thanks for having me.
You know, one of the reasons I love coming to HIMSS and being part of it is that we bring so many different people together. As we just heard from Washington, you're also from Washington joining us. There have been Silicon Valley investors, there have been hospital administrators. I mean, it's amazing to get everyone sort of under one roof.
A lot of diverse people here, a lot of energy, so it's great to be a part of it. So thanks for taking the time to talk to us about this.
Thank you. Yeah. So what's your mission this week as you kind of work the floor and lead a couple of your breakout sessions?
Well, we're always interested in things associated with immunization and, of course, immunization information systems. And so this week we're excited to announce the release of this immunization integration program effort that we've been partnering with HIMSS on, and it's sort of a program to advance immunization-related capacities in EHR and other clinical systems. So we're really excited that this is taking place, and just thrilled to sort of get it off the ground. And it's been an effort we've been working on for a number of years, and just really excited about it.
Why has it taken so long?
Well, we've taken a lot of time to do a lot of interviews with people. We've talked to a variety of stakeholders, clinicians, public health professionals, people that are really knowledgeable about immunization-related workflow. We designed the program so that it would take advantage of all of those nuances that we wanted to be aware of, and really try to do it right so they would meet some of the needs of clinical medicine as well as public health, and address a variety of different parameters that we were looking at as far as the immunization-related capacities are concerned.
And what are the diseases you're most focused on?
Well, so we're interested in all vaccine-preventable diseases, and so our group is focusing on the immunizations that are, designed as a prevention strategy to prevent those from happening.
But I mean, that could be thousands.
Well, I think there are like 25 or so that we are most active in trying to deal with in this country, and so those are the ones that ACIP recommends that we mainly focus on, and they're all the normal childhood and pediatric and adolescent and adult vaccines that we're all sort of interested in trying to make sure everybody's vaccinated for.
And what's the most effective means of distribution? Is it through the pediatrician, through the school? Where do you get the most traction?
Through the provider for the most part is where all of our vaccines that are administered. So a lot of pediatricians for the childhood vaccines, and as people age, other markets come into play, pharmacies, et cetera. So yeah.
And reimbursements and payments has been a big theme here, obviously. How do you approach that side of it?
Well, we certainly work with the payer organizations to make sure all of that happens. That's sort of a little bit outside of my area of expertise, but we work with the payer groups to make sure that the admin fees are appropriately delivered and that kind of thing.
I ask just because I feel like one of the themes that, not that this is new, but it's just, I feel like it's just so much a part of the conversation, is how all these walls are tumbling down. Data is no longer siloed. People are no longer just doctors providing a narrow niche of it's like everyone kind of has to wear a number of different hats.
Variety of different hats.
Yeah,
and that's I think that, getting back to your earlier question, that's a lot of why we wanted to take the time to make sure that when we were addressing the immunization functions that we were interested in, we talked to a lot of those stakeholders so that those hats that we were trying to deal with could be addressed in this program to make sure that the program was designed to meet those needs for and the various different hats that people have to wear in order to provide those services.
Obviously, you're working at a national level. Are there ever opportunities to work for you specifically internationally?
So our program mostly focuses in on the national level projects, but we do some dialogue and technical assistance occasionally with some of our international partners, and as they come together with questions and so forth, and send people to conferences for cross-fertilization and that kind of thing. So a little bit of technical assistance, but most of us were focused on the sort of the national program. Yeah.
Which makes sense.
Yeah.
As you would expect. And then the integration with educators, with medical schools, with teaching universities, etc. How integrated are you?
Well, so we have a whole team of people who works with educational programs to help make sure that the right information is there for providers and other educators about the vaccine schedule and that kind of thing. So there's a group of people who work to help ensure that kind of thing goes forth, and the educators sort of know what they need to do, and the providers know what they need to do about understanding the schedule and making sure that the right information is delivered at the right time. So
education and integration. It's
important. It's important.
Certainly my takeaway in speaking with you.
Yeah, great.
Warren, thank you.
Oh, my pleasure. My pleasure. Thanks a bunch.
And thank you for your good work.
Thank you.
All right.
Bye.
So, we have an opportunity to meet with so many different people here at HIMSS. They come from all over. They come from Washington. They come from universities, they come from teaching universities, they come from Silicon Valley, and I'd like to introduce Christopher Valchin with CISO. What a pleasure to see you.
Hi, I'm happy to be here.
How far have you come to be at
Came from
HIMSS?
Washington, D.C. last night, weather permitting.
And what's your mission here this week?
Sure, as the Chief Information Security Officer for the Department of Health and Human Services, we have a unique 360-degree view of the healthcare sector. My role is to help lead the operating divisions like Food and Drug Administration, National Institutes of Health, Centers for Disease Control, cybersecurity staffs in the same direction to improve our services, protect patient and our citizens' information, and deliver the quality health care that we promise to.
Help someone like me from New York City, who by definition is going to be skeptical, right? Because everyone in New York is skeptical.
That's your nature.
It's our nature, right? How cooperative are the different divisions of the government within Washington, D.C.?
We have had tremendous success, cooperation, especially with our partners at the Department of Homeland Security. DHS is the sector-specific agency, and they manage critical infrastructure protections for the whole of government and all of those verticals. HHS has a unique and beneficial partnership with DHS because there are experts on both sides that help us manage cybersecurity when it comes to protecting the health and health information of Americans.
And what drew you to deciding to make this your life?
Sure. It's the mission that is easy to get your arms and your head around. Delivering quality health care to those who need it most. Protecting our patient information, electronic medical records, and all the sensitive data that our citizens share with the government is a noble and honorable mission.
Yes, it is.
And HHS, as a sector-specific agency, should be leaning in to help guide cybersecurity protections so that all Americans can benefit from our healthcare system.
So a neophyte question, but indulge me if you would. I can understand why someone, a criminal, would want credit card information, obvious. What is someone going to do with health information?
Well, you only have to think as far as your own personal health record and the kind of information that's in there, not just name, address, and phone number, but your medical conditions, perhaps treatments that you're receiving, pharmaceuticals that may have been prescribed for you, conditions that have long-lasting implications on how you receive health care. Imagine bad guys stealing that information and then selling it to the highest bidder. That could guide all manner of nefarious blackmail, ransom. There's just this whole market of capitalizing on stolen healthcare records that we are trying to defeat, and it's a daily effort. FDA alone, the Food and Drug Administration, they defeat over 500 million attacks on their system every month.
Per month, 500 million.
That's right. People are scanning their systems trying to get in and steal that intellectual property that could be the next big pharmaceutical, could be the next big medical device. The bad guys don't want to spend research and development funds when they can steal it from us. So we work hard to defend that information and make sure it only stays within the people grasp who need it.
One of the tensions, I think, that is just the world in which we live, breaking down silos, making information available to those who need it and can put it to good use for people's own health. That's on the one hand, and then on the other, making sure it's secure. How do we resolve those two?
Well, I refer to that as a creative tension between availability and security. HHS operating divisions, diverse missions, some trying to protect health information from leaking or getting out. Others, like Centers for Disease Control and National Institutes for Health, doing global cooperative research to solve for Zika or to understand the human genome, need open, collaborative sharing environments. That's what makes cybersecurity so interesting, is tailoring controls to the mission and making sure that HHS can deliver on its promise.
Yeah, right. Aside from cybersecurity, what about just the fact that, say in Amazon, as it gets more into delivering prescription drugs, will now have access to everything that you have needed to use, and that somehow that might get sold to, I mean, it's tricky, isn't it?
It is tricky. HHS is a cloud service provider authorizer. So HHS has authorized the use of Amazon, Salesforce, Verizon, and other tools for government use to protect sensitive information. The government has confidence in these cloud service providers to protect sensitive information. We are moving that direction. I would recommend that any organization considering the use of a cloud service provider to have in-depth conversations about how that information is protected. And if you feel, if you reach a comfort level, you should go for it.
Yeah, absolutely. And are people going to be able to hear you speak over the next 2 days?
They are, yes. I have a session this afternoon at 2:30 on Level 5 talking about cybersecurity initiatives at HHS. And I welcome anybody to come listen. It's going to be interesting.
Oh, super. I'm stuck here, but
Sorry.
But thank you.
Yeah, my pleasure.
And certainly all of you can go out and listen to that. So thank you. All right. Whoops. And we'll shake. So Mark Johnson is Director of Global Business Development at Healthcare and Life Sciences at Amazon Web Services. You just heard me ask about Amazon. Certainly we could go on for hours. So much is happening there. Let's listen.
I'm here with Mark Johnson of Amazon Web Services. Thanks for being here today.
My pleasure.
So Mark, tell us about what you were presenting on.
Well, we tried to kind of debunk some of the myths around cloud computing and give the audience a really thoughtful and pragmatic perspective on how they should go about thinking about their cloud journey and what are the considerations that they should be mindful of as they embark upon it.
Excellent. So tell us a little bit about those myths you were debunking. Can you give us a few?
Well, I think it starts with security. It's top of mind and always will be in healthcare. And I think that there's been, unfortunately, a bit of a historical trend where people think somehow they're going to be safer by holding on to their data or their systems within their own on-prem or their on-premise infrastructure or data centers. So we believe that the ability to create secure, scalable applications is actually a robust piece of what we offer. So we have hundreds of different customers that are using AWS to support HIPAA workloads and protected health information, and this is done at massive scale. I mean, we're talking over 20 petabytes of data from one customer being Philips that have been with us now for some time. And they found that by using the AWS services, they can focus more on the creation of value in their applications and solutions rather than the security nuts and bolts, which we've already created as, Lego block services that they can put together and use. So that's one. The other thing is that, you have to go all in versus, have a thoughtful migration and journey. And we support hybrid workloads. We support offline functionality with medical devices as an example. So I think a lot of people have misconceptions about what security and privacy as well as is it a black or white type of solution. And then lastly, I would think that people think that, a lot of people think that they have to build everything themselves, and that's certainly not the case now. We've got a really robust ecosystem of independent software vendors that can create value and bring that very simply to our customers, our shared customers, I should say, so that they can move faster and be more agile.
Absolutely, and you mentioned value a couple of times, so what advice would you give somebody beginning on their cloud journey?
Well, to open their eyes and step back and think about where they want to be first of all. You almost have to, we have a process at Amazon called working back from our customers. So it's almost envisioning where you need to be and whether or not it's your data center that's closed, that has a lease expiring in 3 years, or a major system that needs a re-architecture. So pick your point and then work back very thoughtfully and think about people and process and technology, because technology really just enables a business outcome.
Absolutely.
And you have to be very thoughtful about where you want to be and how you're going to get there. So I think it's that, and it's also then finally recognizing that, these are new things. You're going to take time to learn and train and help your staff move in different new capabilities that they need. So again, we have a variety of different services and solutions to help support that migration, but customers have to think very thoughtfully about it. I would say experiment, learn, scale, and go all in.
Excellent, I like that. So tell us a little bit too about the trends for 2018 going forward.
Well, I've been to, I can't begin to tell you, I should have counted them. It's probably my 20th HIMSS. Wow. So every year there seems to be some buzzwords. I think you'll hear a lot about machine learning and artificial intelligence. But as I mentioned in our presentation just recently, you have to get your data into the cloud first before you can take advantage of these solutions. So, I hope that people will embrace the trends of, enhanced decision support, more nimble development, deployment of new services that might be patient or provider based. But you have to think again about what are the foundational things that you should be doing to prepare yourself for the future, which I would argue is today.
I would agree with you. Well, thank you so much for being here, Mark. I hope you enjoy the rest of your time at HIMSS.
My pleasure. Really enjoyed it. Thank you.
Thank you.
Well, as we were just listening to that last conversation, guess who appeared here at HIMSS? Jared Kushner. Yes, that Jared Kushner, in from Washington, D.C. He was here actually making a few comments about interoperability and trying to improve patient access to patient files. Interesting. We'll have to see whether that becomes some sort of policy. Again, that's why we tune in here at HIMSS, because all sorts of breaking news happens. So we will keep you posted on that. In the interim, we just want to give one of our sponsors an opportunity to introduce themselves to you.
Listen up, heart disease. You too, unnecessary ER visits. And hey, unmanaged depression. Don't get too comfortable. We're talking to you, cost inefficiencies and data without insights. And fragmented care. Stop getting in the way of patient recovery. And pay attention. Every single one of you is on our list. At Optum, we're partnering across the health system to tackle its biggest challenges. Optum, how well gets done.
All right, now we're going to meet Ian Hofberg. He is the HIMSS subject matter expert on Innovation Live. It's a new exhibit area that was designed to foster, as you would expect, innovative companies, and it all happens live. Thanks for being here.
Thanks so much for having me.
All right, so for people who sadly cannot be here and out on that huge floor right now where there are 40,000 others, what will they see, or what would they see at the HIMSS Live event?
So because the exhibit floor is so large, it really is a great place for people to come and check out all of those innovative products that we are talking about on a daily basis. Come and check out the blockchain companies, artificial intelligence, play around with virtual reality.
Love it.
Hands-on experiences, which is what we really wanted to bring our attendees this year.
Okay, so I can understand how people can put on goggles and sort of immerse themselves in visual reality, augmented reality. How do you experience blockchain?
Well, I think it starts with education.
Right.
It's still really kind of one of those subject areas that it takes a little while to really digest all the ins and outs of it. Go there, meet with the folks who have these types of products, and they can give you an idea of how this can really help you save money, make sure you have accurate records, provide security for your records, and it's really going to help propel you forward. Because really at Innovation Live, we have over 120 exhibitors down there, which is record-breaking this year.
That's amazing.
We don't just have exhibitors, though. We also have some great education programs going on all day Tuesday, Wednesday, and Thursday. So it's really great experience to come down there, interact with those who are really pushing the envelope and have that cutting-edge technologies, such as the blockchain technologies, the AI, but you could also learn from these folks as well and see how it works best within your own organization.
Well, what most impresses me about just being part of this organization is the enthusiasm, the passion. I mean, everybody here is so excited. You know, and it comes across.
Well, what could be more exciting than having 42,000 of your closest friends come together all in Las Vegas and having a great time and learning from each other and bouncing ideas off of each other. And it's innovation is happening here. It's happening on our show floor. It's happening between the conversations people are having in the elevator on the way to the conference or on their way to a dinner or a drink. So it's such a great opportunity for the networking, which is one of our main pillars when it comes to our global conference, is education, you want the networking, and then you also want to have your time out on the exhibition floor. So it's a tremendous opportunity for folks to join us.
So 120 exhibitors just within HIMSS Live,
just within
the innovation area.
Correct.
I would imagine as many as that is, there were many more who wanted to be a part of it.
And they will have that opportunity because we continue to grow.
Yeah.
You know, this year we broke some records. This is bigger than we've ever had it. but next year in Orlando, it's going to be even bigger. We're going to have a large footprint, just like we have this year within Innovation Live, but next year we're going to have 2 additional areas where folks are going to be able to come and, again, get hands-on with the technology, play around with the different technology, and really better understand what it can do for their own organization.
So you mentioned AR, augmented reality, where you put on the goggles. You mentioned blockchain, which is fascinating because we're all talking about cybersecurity and breaking down silos at the same time. Maybe blockchain gets us there. What else? What are some of the other sort of innovation themes that we'll see at the Innovation Live booth?
Well, the technology innovation touches on a lot of different areas. So it could be focused on, for instance, the Internet of Things, where they're maybe focusing on more of the patient engagement side. We look forward to having more of the biomedical stuff that's down there. So come check that out and learn more about how biomedical plays within your own organization. But that's just the tip of the iceberg. So with that many organizations down there, you'll find a solution to whatever that problem might be, and you'll also see where you need to be moving forward, because innovation is change, and that's how Wolf, our CEO at HIMSS, expressed it last night during our opening keynote. He mentioned, innovation is change, and change is going to happen regardless. So you need to come and learn about these technologies so that you can stay with the program.
Right. Well, one of the things you mentioned, Internet of Things, obviously big change, but I think that's why, and you tell me, I'm sort of wondering here. I feel like there are more medical device makers, or there's more of that conversation than years past. Is that because devices that are now, well, they can be attached to the internet, whereas in years past that wasn't even a conversation?
True. We've gone leaps and bounds with the technology, being able to connect ourselves through our phone, through our mobile devices. But now we're connecting through our refrigerators. We're connecting through the Google, through Google, Home Google, and through Amazon, Alexa, and all of these other fine products. But it's really bringing the technology into your hand, and it's allowing you to be part of your own healthcare and to be able to follow and provide yourself with that care management that's going to help you be a healthier person and follow your care plan appropriately moving forward. So, and it's going to reduce costs. So that's really where we're trying to go. Better health, reduce costs, and provide better satisfaction.
And that sort of personal responsibility thing, where we're all now more involved than we used to be, right? I mean, that's certainly part of it.
Sure. Absolutely.
Yeah, that changes the picture.
And being part of it, in Innovation Live, our sponsor Google Cloud is down there, and they have a great a setup down there where you can come and learn more about their cloud systems, because a lot of this is transitioning to that cloud service. And so those are the types of technologies that are going to allow us to move forward. The artificial intelligence is going to allow us to move forward with providing that better level of care.
Love it. Well, Ian, I'll come find you a little bit later.
Please do.
I'm stuck here in front of the cameras for another hour or two, but then I get to go out on the floor and see the action myself.
We'll come down to level 1. We're in Hall G, booth 9900, and I'll be there all week. So I look forward to seeing you and many of our other attendees.
Love it.
Thank you so much.
See you this afternoon, Ian. All right, we are joined now by Robert James Taylor from Siemens, and I told you that there are all sorts of different businesses that come here, and I'm so excited to finally have this conversation. I was a former stock picker and loved industrials, and I think of companies like Siemens, like Schindler, also in Germany, and now Siemens here at HIMSS in the medical business. Exciting. What's your mission as you come here and sort of spread the Siemens word?
Right, so Siemens has for a long time been really a leading provider of diagnostic equipment. So in terms of imaging and in vitro diagnostics and interventional therapies, Siemens is really right up there as market leader.
Yes.
So we have a very strong footprint within healthcare institutions. And flowing within those diagnostic domains are tremendous treasure troves of information and data which actually contain great opportunities to get ahead of disease, uncover care gaps, and trigger proactive follow-up to go and close those care gaps. So our mission here at HIMSS is to communicate this message that within the diagnostic domain, there's so much we can do to really start looking longitudinally at getting ahead of disease and getting ahead of costs and outcomes.
So I had a conversation with a gentleman by the name of Vala Afshar, who is the Chief Information Officer at Salesforce.com. He told me that we're collecting maybe 1% of the data that we possibly could. You want to put your own percentage on that one?
You know, in terms of percentages, medical imaging and lab diagnostics, genomic sequencing, I mean, this is really big data.
Big.
And so what has happened traditionally is that we extract a small snippet from that through a diagnostic report.
Right.
But behind the scenes, there's a tremendous additional amount of information that we're just missing out. So the 1% to 99%, it's a valid comment. And we're driving initiatives using AI, natural language processing, image analytics, to automatically analyze those images and catch what may have been missed in the primary purpose for the exam. And that's where we turn up great opportunities to drive additional early intervention, screening, and so on.
What are some of the new products that you're introducing over the next few months and even talking about here at HIMSS?
Sure, so the primary product is this proactive follow-up solution. So today in a diagnostic domain, you typically have exams being performed, reports being written, and the proactive follow-up solution is an AI-driven layer which sits behind the radiologist or the interpreting physician and keeps a second look on that to say, hey, if you just reported that there's an incidental finding, a small aneurysm, it may not be actionable today, but that's actionable in 2 years.
Yeah, right.
So we're going to create a punch list, an action list of findings we locate now, which need action downstream to avoid them escalating to a critical, urgent condition, which obviously drives bad outcomes and a lot of costs.
Sure. I mean, there are two really wonderful ways to look at it. Number one, it becomes preventative care. You're giving the patient a heads up. This could be an issue, and presumably saving lives in the process. Number two, you're, I would think, lowering costs because you're getting ahead of it. And number three, you're also actually, and I hate to sound mercenary, but you are helping healthcare providers find other opportunities to find revenue streams. I mean, it's everybody wins in that scenario. Am I missing something?
You're not missing something. It's a valid point.
Right.
And you know, you make a point, it can sound cynical, but the reality in the world is the best therapy is the one that people will actually engage with, right?
Yes.
So given that we do have a health system that's still vastly dominated by fee-for-service, if you actually want to drive change, you need to find something that's a win-win. So it drives more appropriate fee-for-service volume while overall improving outcomes and managing the total cost of healthcare.
Right.
So really what Siemens is about is diagnostic, screening, early intervention. So we're really about helping to move the costs from that long-term therapy, chronic care scenario, shift them upstream into earlier detection and prevention, where it's a much better place to spend money because you save money later on and you improve outcomes and quality of life.
You have the unique perspective being based in Europe of engaging with customers around the world. Which health systems do you think do the best job of bridging that gap between patient and provider, using the types of systems that Siemens produces?
You know, that's a really an interesting observation. We do interact around the world, and you know, we know that the United States is a very much a fee-for-service model, very fragmented healthcare. Right. So you might think things are different in Europe or something, but actually they're not. It seems to be that uniform across healthcare globally is that we're organized in vertical silos where we go after what's right for the department or the service line or the surgical specialty. And the challenge for all of these health systems is
knock down the silos.
Drive culture change from the top down, organize people to collaborate around patient journey, patient experience, outcomes, and that's uniform across the world. So that need to drive that culture change and to support that with appropriate data that allows you to organize around the patient's concerns. That's what really we see as a common theme globally.
Yeah, certainly. Before I let you go, are you presenting either today or tomorrow where we can send people to go hear more?
Absolutely. On the Siemens booth, you'll find a population health stand where they'll be demonstrating this proactive follow-up solution as part of our healthcare ecosystem.
Wonderful. That's out on the floor. I'm in front of the camera for another couple of hours, and then I'll come see you.
Perfect. Thanks very much.
Thanks for being with us.
No problem.
All right. Joyce Semsmeiser is, well, I'll tell you what. Why don't you just jump right in? You're with HIMSS, so we're all in the family here.
We are.
Would you please help me pronounce your name correctly? I stumble every time.
That's okay. Sensmeyer.
Sensmeyer.
Yep.
Got that?
Blame my husband.
and if I told you all of the initials and acronyms after her name, you would be here for another 5 minutes. You're extremely accomplished, and we're thrilled to be able to sit down and speak with you.
Thank you.
What's your mission as you're walking around talking to people over the next couple of days?
Well, I've been with HIMSS for 17 years, so I think I've lived and breathed the mission. And to me, it's to get our members engaged, to really give back to them. They share so much with us with their thought leadership. And it's great to see them all together in one place and to really make excitement happen and learning and taking it to the next level.
Yeah, yeah, it really is. And by the way, I just want to let people know, because it's so noisy as Joyce and I are trying to speak, that is because we are at HIMSS. There are, what, 45,000 people here. It's the largest healthcare IT conference in the world. And what you're hearing is the PA system making announcements about different events happening on the showroom floor. So don't be alarmed. Nothing bad is happening. It's actually everything good, but we just wanted to let you know what's happening there in the background. Joyce, over the 17 years that you've been part of HIMSS, how's it evolved?
Well, it was, certainly a lot smaller than it is today. I would say the expansion of what we focus on. So my areas are interoperability and clinical informatics. My background's nursing. But our communities have grown. We have 8,000 informatics nurses that are a part of HIMSS now, and bringing them together in events like the symposia yesterday, seeing how the industry has evolved from EHR focus to really now innovation, a lot of more technology that's been incorporated and beyond the EHR, predictive analytics, the exciting things are happening now.
Yeah, I'm glad you just said predictive analytics, because that's one of the, first we collected data. Well, first we collected data with a pen and paper, then we collected it with machines. Then we started to use that data, and we're still figuring this out, to cross that bridge to artificial intelligence, but now it's become predictive analytics. Can you talk about exactly what predictive analytics does for us?
Sure. So to me, as you said, we now have the data. Let's leverage it.
Yeah.
And predictive analytics will allow us to see what makes a difference, what care practices make the patient's care better, make better outcomes for patients, and getting the data right is a part of that, structuring it in the right way so that you can analyze it and then see what makes a difference is the exciting thing that I'm hoping for. And then precision medicine, being able to then identify the right treatment for the right patient, the right nurse in the right place. Those are the kinds of things that we're beginning to realize now. Getting towards it, not solved yet, but on our way.
How much of this is actually taught in nursing programs as opposed to on-the-job training?
It is still on-the-job training, and that's the way I learned. We're trying to share that knowledge across the industry, but schools and programs are a little slow to the table. HIMSS has a Tiger initiative that is really influencing curriculum, especially for nursing, so that we are equipped to have a technology-savvy environment and to work with it.
Why do you think that the nursing schools have been sort of so slow on the uptake?
Well, part of it is faculty is aging, so we, like my generation, we didn't start out with computers. We had to learn all of that. So faculty has put in place a curriculum that didn't start with technology. So they're kind of slow to the table. There's uptake now, but I think it's just the whole academia environment. Research is 17 years old. It's just kind of slow to the table.
Right.
But they understand that, and we're trying to equip them to do that better.
I mean, the systems that are out there now, I mean, you walk into, well, assuming you can actually walk into an ICU, I mean, it's staggering.
Yes.
I mean, 10, 11, 12 machines around a hospital bed, and the bed itself is a complicated machine.
Right.
How do you integrate all these systems?
Yeah. Well, standards are required for that, and we have a number of initiatives at HIMSS with the clinical engineering group to get all of that connected. So if they have standards as a baseline, they can get that in place, but then can also capture that data and bring it from the home. Telemedicine is enabled to really extend from the hospital environment to the home. So I think, again, it's another wave of innovation that's really critical to the next generation of nurses, of caregivers, and technology in healthcare.
I have tangentially touched on telemedicine with a dermatologist where I had a sunspot, and he said, well, just take a picture every couple of days and send it to me, and I did, and I just thought it was brilliant, but it's so obvious. I'm not sure I'll call that telemedicine, but I was using my telephone. Where do you think we're ultimately going with telemedicine?
Well, it's I think it's being enabled. Cleveland Clinic is one of the models for that, so they have a lot of capability, and they extend that globally now. But the reach really needs to be into rural.
Yeah.
The challenge there is that the bandwidth is not at the ready to enable that, so the potential is there. Still have to push the technology and make it get in the right place in the right way to make that happen. You touched on the images and on sending that to your physician.
Yeah.
The challenge in the enterprise now is every physician is wanting to capture images and get them into the electronic health record. So one of the initiatives we have is enterprise imaging. So taking that from just radiology and now expanding it across the enterprise. So it's another new area that we're focusing on also.
And might that actually be, just to run with my example, so my doctor would take those images that I sent to him, and he might then put them in a database that becomes hundreds and then thousands and then tens of thousands of examples of what these different sunspots would look like.
Yes, absolutely. And then you would have access to that, not just he or she, but all of the physicians and the caregivers in that environment that could access the electronic health record through the PACS systems. So there's a lot of data.
Boy, there really is. Joyce, thank you so much.
Thank you very much.
All right, what a pleasure. All right, Geraldine 7-Acre, VP of Revenue Cycle at Sharp Healthcare. Let's listen.
I'm here with Geraldine 7-Acre. Thank you so much for joining me today.
You're very welcome.
So tell me a little bit about your session.
My session was about consumerism and patient-centric services and what's happening in the healthcare field around the consumer and actually our employees, and how we're driving to a very patient-centric workflow. In healthcare, having things patient-centric is no surprise. That care experience is about the patient. But we may have lost a little bit of that when we're talking about our revenue cycle and how we can personalize that revenue cycle experience. That's your entry into the facility and that post-experience billing process where I could actually personalize that a little bit more, and we're looking to bring that to a more patient-centric platform.
Excellent. So tell us some ways that you're doing that. How are you streamlining the process and what changes are you making?
We're looking at the demographics of our population, and we're looking at what is that new digital native patient going to want, and am I addressing those needs? Am I reaching out to our patients, our consumers in the platform that they desire? So am I equipped to chat, text, email, in addition to having a phone call? Social media right now is the primary form of communication in our next generation. And have we prepared our platforms to allow for that intake, the consumer preference intake of their questions and responses?
Excellent. So tell us a little bit about the results that you've seen so far. And I know one thing that you've spoken about is the convenience and making it more convenient for the patient. So tell us about that in action.
Well, from a patient perspective, we've opened up a portal and allowed them to see and select how they want to process their payments. It allows them to view every open balance they have with our organization, and it allows them to pick and choose how they may want to pay that open balance. It also gives them an option of extending their payments within specific parameters so that they have an easy way of installing their payments to the organization.
Excellent. So what does the next 5 years hold?
It's actually twofold. I think we're going to see technology blossom, and not just in the revenue cycle arena, but actually in the entire healthcare landscape. Not just from the consumer perspective, but how our employees work within these various platforms. And I know we at Sharp are looking at how can I make that workflow engaging for my employees, and how can I make that experience for my employees something that they want to come to work for, they feel good when they're doing it, and they leave with a sense of accomplishment at the end of the day. So we're twisting the workflow a little bit and gamifying it so that throughout the day they see the elements of gameplay play out in front of them on their own personal dashboard and on a dashboard in their work area.
I like that. That does sound a lot more fun. Well, thank you so much for being with me, Geraldine.
My pleasure. Thank you.
Thanks, everyone.
All right, time now to meet Max Stroud. She is the lead consultant for Galen Healthcare Solutions. And Max, you are really on the cutting edge of this whole ERH debate, which I almost feel like has become kind of a bad word. Because there's so much innovation that's happening, people don't want to do it the old way. Tell me how you deal with this transition from old records to new digital records.
Well, it's definitely a challenge, in part because a lot of old systems and legacy records have different architecture behind them. They're built in different ways, and then all of the different EHRs store their information in different ways. So we do a lot of work with helping migrate people from one EHR to another. And it's something that really kind of gives a lot of visibility into how disjointed a lot of that data can be. It's really hard to normalize the information.
I mean, just integrating systems. I was talking to someone actually with the Department of Defense. We weren't talking healthcare, we were talking actually missile systems. And you would think the U.S. has missiles, and they'd all be every missile has its own system, and it was just amazing to listen to the perspective. And actually, I think about healthcare, where it's not just a few hundred missiles, but actually hundreds of thousands and then millions of patients, and there's just so much more.
Yeah, and you know, for the patients, it's really the hardest because most of us in healthcare work in our own organizations, and so we're thinking about data from the perspective of my hospital, my medical group, my acquisitions, whereas the patient may be seeing their primary care provider in one hospital, a specialist in a big city, you know, and accessing their information from all sorts of different places that aren't connected. And so the default for them often, if they need to use their information, is to go to a binder and just print everything they can, get copies of everything they can, and carry it with them because it's so hard to actually get the information in an actionable way for the people they need to share it with.
How do you take all that volume and distill it down to just the essentials? I mean, that's a tough process.
It is, and you know, there are specific things that providers look at every time they look at a record. You know, problem lists, histories, medications. We do have some structure around, we know what providers want to be looking at. And we even have some ideas going into the future of what providers want to be looking at, like calculators. They want to see risk scores. They want to see, you know, we have all this data in their system about heart risk, but we don't have a Framingham risk calculator built in, so then they have to take that information and like plug it into a different web page. You know, it's not, it doesn't really make sense. And so we know a lot of the priorities. It's just a matter of kind of getting that information to the right people at the right time.
Yeah, one doctor I spoke with earlier told me that she typically will spend 5 or 6 minutes with a patient and sometimes up to 45 minutes on filling out paperwork and stuff after. I mean, that's mind-boggling.
Yeah, it is really mind-boggling. And I'd love to speak to that doctor because I could probably help her out a little bit.
Yes.
You know, there's administrative things that providers need to do. We're locked into this fee-for-service economy where you know, they're only paid for the time that they're working on that patient. So you don't have prep time, you don't have time to follow up, and documentation comes with barriers. And so, I mean, there are lots of efficiencies that can be made. I work with optimizations all the time. We sit down with doctors, look at their notes, find the places where we can, you know, save them clicks and use information that's already there, or build tools in to make things more efficient. But it takes a good bit of work. And often when people are initially implemented, it's kind of, we need to get this EHR out fast, we need to get it done, and we'll go back and do this optimization thing later. And then, and then you're there.
It never happens.
Yeah.
Yeah. I mean, I guess my response is, but why can't they teach this in med school? But I guess your response would be, because it's changing so fast, right?
Right, and I think that, you know, you definitely see a difference when you're on a campus between a doctor who's in their 40s or 50s and a doctor who's fresh out of med school. Even around, like, what their attitude and relationship to technology is. So, you know, a provider who's been around a lot longer and seen the EMR come in, they are kind of frustrated because it's clunky, it's hard, their experience with it over time has not been good. Whereas a younger provider comes in and is like, oh, I know this can work better.
Yeah, right.
I am familiar with technology, use it all the time, my daily life everywhere, and I don't understand why this isn't working for me the way that it should.
Patient stories matter to you.
Yes.
How do you use them?
So I fell in love with this piece of the work through my father and my sister's cancer journeys, and working with them and helping them kind of figure out their path. It brought me to this passion project of working with patients and really helping people use those patient stories to find where the rub is and where things are not working for patients. I spend a lot of time helping providers and optimizing their workflow, but nobody really spends that time and attention on the patient side. And I think that's a place where we can do a lot of innovation if we really spend time thinking about it.
Listening to your patients, right? It's like Health 101. Max, thank you so much.
Thank you. It's been a pleasure.
Yes, well, for me as well. Thank you.
Thank you.
All right, Indu Subaya is Executive Vice President of Health 2.0. HIMSS actually has recently purchased Health 2.0, and we just spoke with Matthew Holt earlier, and what a pleasure now to speak with you. So we've got the whole 2.0 crew.
That's right.
He's fun to work for, I would imagine, or work with.
Yeah, exactly. Yeah. Ask him. Exactly. That's funny. Yeah. It's been a really fun ride. We've been working together for coming on our 12th annual Health 2.0 conference. So.
And as he explained it to me, and now you put it in your own words, Health 2.0 was about sort of the more patient-specific or smaller aspects of health IT, as opposed to HIMSS, which was enterprise-wide. Right. Is that a fair way to think about it? And now they're all coming together.
Exactly. I think it's sort of where the two organizations and communities started. That's interesting. I think HIMSS started within the world of providers and has been reaching out, if you will, outside the walls of providers for many years now. With patient engagement, patient-provider communication, telehealth, and more. So sort of from an inside-out approach. And Health 2.0 kind of began from the outside, if you will, with technologies that were enabling consumers to take more control of their own health, technologies enabling patients to take control of their health. So I think we've sort of moved more in with then those technologies connecting into the EMR, connecting into the clinical environment. So you're right, we were sort of destined to meet in the middle, which is kind of where I think we are now, which is a really exciting time to really not be dividing the world so much into health systems and consumers, but really seeing it holistically.
Yeah, right. I almost sort of feel like it's just reflecting the fact that patients and providers now, your doctor, a doctor will always be smarter than the patient by definition, but there's like a coming together, like a partnership that maybe 20 or 30 years ago there wasn't, right? The doctor said, here's what you do, and the patient said, yes, I will do this.
Well, just to challenge ourselves on even that first assumption, like, my grandfather who had asthma and lived with asthma for many years into his 90s and was very healthy and lived a long life even with his asthma, he always said to me, he said, an old patient is smarter than a young doctor. Huh. An old patient is smarter than a young doctor.
Fascinating.
Because when you've learned about your own condition and lived with it, you gain a different kind of wisdom. Right. And so I think it's not so much that doctors will always be smarter than patients. In fact, I think now we're looking at a shared knowledge economy of health that really no one really owns. So how do you explain the fact that today I can go get my own genome sequenced and know more about my own genome than my doctor? My doctor might not be able to help me understand the implications of that. I might be able to get a rapid diagnostic test from my own home directly with the manufacturer.
Right. Yeah, right.
So I think it's an interesting time where that dynamic is shifting for so many reasons. But I agree. I think the technologies and the tools are helping us partner in a more
personal, human, humane,
all of the above way.
Right.
And when you take kind of information and you are symmetric about it, there isn't information asymmetry, and you can both sides can have access to the same information. I think amazing things can happen. And I think technology is a part of that. So everybody that always says, well, isn't this stuff getting in the way of the doctor-patient relationship? And I said, well, it depends. If you see the doctor-patient relationship as really siloed and in the sort of old-fashioned model, then perhaps.
Yeah, right.
But if you see it as the sort of shared knowledge base that we ought to have and make decisions together, then no, I think it's improving the doctor-patient relationship.
Yeah, it is. Yeah, it's all about partnership. As you are here talking with people, leading some of the sessions, what are the messages you're trying to convey? What do you want to tap in on?
So we just gave a talk yesterday at the Innovation Symposium, the closing keynote, and I used the phrase "health happens everywhere," and it's this idea that it's not so much the patient at home, or we were so fond of saying at home, but it's really everywhere.
It's everywhere, yeah.
And I think we're seeing the sort of data ecosystem and the technology ecosystem rising up to support that. Whether you're making a healthy food choice in the supermarket, or you're in your kid's school, or you're in the park and breathing the air, it's the workplace. It's really everywhere. And I think, what do we need to do as sort of a technology community to enable that interconnectivity, I think is exciting. So we're definitely raising awareness about that. We're really interested in the new modalities that we're seeing out there right now, from the AR, the VR, all of that. While it's sexy and interesting, what you're really fundamentally seeing is a shift in how we interface. The interfaces to technology are changing, and today it might be
You mean how we as patients and people interface, like with this thing, and this becomes a medical tool.
Exactly. It could be the clothing we wear with sensors implanted. It could be Nest, the thermostat in our home. It could be the car we're driving. We're seeing now a lot of car manufacturers getting into our
health?
space. Absolutely.
All right, talk to me.
Honda is going to be presenting at Health 2.0 in the fall, and you are absolutely going to see Ford and others, because it's an environment, and there's digitization. There are sensors. There are more sensors in a car than there are in most hospitals today. So health happens everywhere will require these new modalities and these interfaces. Voice, of course, will be a huge component of that, as you've seen with Alexa and Google Home and Siri. So we're also making the point that with new modalities come disruption in business models. So you're going to see that happening across the board. Whoever you are in healthcare, we're going to face a challenge in a business model, have to think about business models differently.
Yeah, right.
And I think those are some of the key messages. But it's a fascinating evolution to watch for the last 10 years.
Oh yeah, and I feel like it just got turbocharged in the past 14 months.
Exactly.
So exciting for us to both be here.
Yeah, indeed.
All right, Edu.
Thanks so much for having me.
Thank you.
Okay.
All right, Alex Worth is a healthcare architect. He's with Symantcorp, and we talk about all the changes happening in so many different ways. Well, here you go.
I am joined by Axel Worth with Symantec. Axel, thank you so much for joining me today.
You're very welcome.
So tell me a little bit about your session, and particularly the security risks with medical devices.
Yeah, so the session this afternoon will specifically look at cybersecurity as it pertains to the medical device ecosystem, looking at the risk profile of medical devices, discuss what the actual risks are, and then of course go into mitigation and how to address it both organizationally, from a policy and procedure perspective, but then also obviously from a technical level.
Sure. So what are some of those risks with medical devices?
So what is interesting about this topic is that the risk profile is actually quite broad, in a sense that, the obvious one everybody talks about is patient safety. Right? A medical device incident can harm a patient. Whether it's targeted or not, the risk is there. But then there are much more complex risks around, for example, data privacy. The device can be a security risk by itself to the rest of the network. And then, of course, there are indirect risks around hospital reputation, patient treatment decisions, and so forth. So it's quite a range of risks that need to be considered if you look at the medical device issue.
Absolutely. So what solutions have you put in place so far? And I'm sure this is something that changes all the time. So what does the next year hold for this?
What we're pitching is a number of things. On the healthcare provider side, obviously, start in procurement, right? Specify your security requirements. Make sure that what you're buying going forward is more secure than what you have today. And then from there, it goes to the network. Make sure that your network architecture supports security, segregated networks, but also then the human side, handling. Right? Make sure that USB sticks are not used indiscriminately on medical devices. And then lastly, all the way down to incident response. Make sure that you have an incident response plan that considers medical devices and their unique use case. Right? You cannot just reboot a device. You cannot just reinstall the operating system on a device. Those are technical decisions that need to be balanced against clinical decisions, whether it is a specific patient currently connected to the device or decisions around rerouting patients around care delivery, but much more complex. And those decisions involve an individual device, could involve an entire care delivery function or department, and in the extreme case could actually include the entire hospital.
So what would something be, or a piece of advice that you give somebody who is not familiar with this area? What is the most important thing to know?
It's a multi-stakeholder problem. Make sure that you include the IT side, the technical side, but also the clinical and executive side of the hospital. Make sure you engage with your vendors. Build a specific relationship around cybersecurity with your vendors, and don't be shy in pressuring your vendors to become more secure. Right?
I like that.
Many are on board, but many are still, let's put it politely, reluctant.
Well, Axel, I think that's wonderful advice. So thank you so much for joining me, and enjoy the rest of your time here at HIMSS.
Okay, thanks for having me. Appreciate it.
Thanks, everyone.
All right, welcome back. Like so many people here at HIMSS, we now have an opportunity to speak with a doctor who has shifted to business. She is Geeta Nair, Chief Healthcare and Innovation Officer at Femwell Health Group. Doctor, thank you for being here.
Thank you. Thank you for inviting me.
You were again, a rheumatologist and decided that you wanted to make a switch to business. Why?
Well, you know, I didn't go to medical school thinking I would ever do this stuff, right?
Of course.
I went to medical school because I wanted to take care of patients and I wanted to do it well. And one of the most frustrating things about being a physician today is it's very hard to do that because so many of the tools that we have to use as physicians actually slow us down. So with my clinical background, my business background, and my IT background, I'm really able to make an impact on thousands of patients in a way that I simply couldn't do in one-on-one patient care. So it's incredibly exciting and gratifying for me.
So when Femwell approached you, how'd they describe the opportunity?
Well, you know, there's a group of 500 docs. We're an MSO in South Florida. We have about 500 physicians, and they have a lot of challenges like every physician around the country. And they said, you seem to get this IT stuff, you seem to get the clinical stuff, and we need someone who's going to help our doctors be able to scale and take care of our patient population better.
One of the themes I think that, and this is not exactly new news, that EHR isn't working and we're reinventing it and finding new solutions. But was that part of your job description, part of your mission, just reinvent this, streamline it, make it easier for our doctors?
You know, a little bit of everything, right? So now in a value-based care environment, it's all about the patient, it's all about how to engage the patient to actually be healthy. And that's what I'm really seeing at today's show, is it's really about how do we actually make things interoperable, how do we get the patient, not just to manage a population, but to engage, because once you engage the patient, they're healthy and the population is healthy.
Here's the tricky part, and I'm not sure anyone has really figured this out. If you're no longer getting fees for service because you're, in theory, providing fewer services to keep the patient healthier, how do you make it worth doctors' while, you know, to make that transition?
Sure. So it's all about the outcomes, right? And again, the reason I mentioned patient engagement is, as I said, we know that patient engagement is tied to outcomes. So as a physician, I want my patients to get better, and if I can get paid for them to get better, I don't need to worry about doing 10 other procedures to get there. And you know, one of the biggest chatter that I've seen also at the show is around class. Class for the first time covered patient engagement as a category. It's no longer about EHR, it's now an entire category because we're seeing that that is the only way we're going to be able to connect the dots. It's not about the vendors, it's not about the doctors, it's actually about the patients helping us get to the outcomes that we want.
All right, so let's say we've got a patient under the old system, a patient under the new system. In the old system, there's fee for service, and the person has to go back into the hospital. In the new system, there was some sort of preventative treatment. Person doesn't go back in the hospital. because the person doesn't go back and is compared to the other person, there's a bonus paid to a doctor?
Well, again, it's about outcomes, right? And it's about really meeting the patient at the point of care. So if there are things that I can do to prevent you from going to the hospital, absolutely, we want to make sure we're doing that. And if we can text you, remind you need to come in to get your eyes checked, you have glasses, you got to come once a year to get your eyes checked, right? You don't want to wait till you have a cataract, you don't want to wait till you have glaucoma. So there are all kinds of things that we can now manage and metrics that we know are very measurable, right? So even at the end of the day, if you end up in the hospital, but you followed sort of the normal preventative task force measures, absolutely, as a physician, you should be incentivized for that, because you can only do so much. But again, it's about bringing the actual patient into the picture and saying, you know, if you get these things checked, you won't go to the ER, which is kind of what you want too, right?
Yeah, I'm just trying to figure out, you know, as we extrapolate and go out, you know, 2 or 3 decades, you know, what does it look like? I mean, teachers get bonuses if test scores are higher. Some will debate whether or not they should, but that's standard practice. Is there an equivalent way to think about it within healthcare?
Absolutely. I think that, again, value-based care is still evolving, right? But there's any number of metrics that we know are very good metrics for any population, whether they're diabetics, hypertensives. So it's about following the standard of care and making sure that the metrics are really solidly determined and, and measured and transparent, both to patients and to docs.
Any moonshots here that you have seen at HIMSS18?
Sure. So, you know, again, I think it's really about patient engagement. The partner of choice for us is HealthGrid. We are doing some really amazing stuff in the female wellness space in South Florida. And we're really finding that when we meet patients, when we meet women where they're at, whether they need to get a mammogram, a pap smear, an annual well visit, a simple text actually goes a long way. And it's nobody wants to sign into a portal. Nobody wants to have to remember a username or a login. And so we're actually finding the mobile connection does a lot for us. We also are very much behind telemedicine and the idea that, again, we're going to meet you where you're at, and hopefully that's not an emergency room. So by making it easy, by making it mobile, and really meeting patients where they're at, which is on their phone, we get a lot more bang for the buck.
It's funny, there's an intimacy to the phone. When you get a text, it somehow feels better.
You know, and actually a lot of our patients are actually texting back saying, gee, Dr. Nair, thanks for texting me.
Right.
And they're actually having a conversation. Like, you know, and it's phenomenal what a few texts will do. And all of a sudden it's like, you know what, I will come in. You send me that text, I am going to come in. I meant to make that appointment, and since I now just got to click and press a C for confirmation, I'm going to make sure I come. And thanks for reminding me to bring my medications.
Yeah. And by the way, thank you for being here.
Thank you, Adam. I appreciate it. Thank
Dr.
you.
Dr. Nair. All right, Tom is with HIMSS. I had an opportunity to speak with him, a couple of days ago in advance of what's happening here. So much to talk about. Here's Tom. All right, Tom, head of government relations for HIMSS. I would imagine you are the busiest man on the planet right now, right? I mean, everything's changing, right?
Absolutely. We're having a great time.
Well, even though we don't really know whether the Affordable Care Act is still part of the plan or not, right? I mean,
the beauty about healthcare IT is that irrespective of what they decide on how to pay for care, information technology has to be the foundation. Yeah, information and technology, absolutely.
Very
so
true.
Whatever they throw at us, this community can handle.
Yes.
Yeah.
That's reassuring. It's good to know. So where are you focused right now? Again, head of government relations for HIMSS. What are the opportunities and what are the pressure points?
Sure. So as far as from an opportunity perspective, we really are talking to government about cyber, telehealth, and how to better use the data that's available to share it across the community so that the right patient right provider has the right data about the right patient at the right time. And we've struggled as a community on interoperability. I think we're at a real key point, particularly in policy, on making sure that we actually deliver on getting that right data about the right patient.
What can Washington do to actually further interoperability?
Sure. What's real helpful is we're anticipating some conversation here throughout the week and then into the spring and summer around some levers that the government can flip. One of the real keys is how do they reduce burden on providers and also engage in more consumer-driven care. So are there changes in regulations that they can come up with? Is there incentive programs that they can really put in place? Now that we have health IT and largely as a foundation across the healthcare community, how do we leverage that and really get to better use of the technology to get the right data available to the right provider on the right patient?
And I would argue that probably most people looking at government, this administration, would argue that the message has been get out of the way and let businesses figure it out for themselves. So how do you navigate that set of challenges?
What we've really been talking to the government about is it has to start with standards-based, so that everybody's playing by the same technology rules, and that information can actually go from point to point. So once everybody's agreeing to what's the standard, then let the community really innovate and meet the needs of the consumer and engage the consumer. So how can government get out of the way is recognizing there are certain regulations that are hampering innovation, and others that with a little bit of tweak we can really expand consumer engagement and provider embracing.
And for people who are fascinated as to how you actually go about doing your job, who are your primary points of contact within the government? Which agencies, what type of people?
The nice thing is where there's healthcare, there's an agency that's interested. So we work very closely with CMS, Centers for Medicare and Medicaid Services, ONC, the Office of the National Coordinator. We were one of the driving organizations to actually get ONC started back in 2004. Department of Defense is very active within HIMSS. VA, we're very engaged with Congress. In fact, we've got 20 congressional staff here this year learning about how they can better
here at the HIMSS conference.
At the conference, absolutely.
Oh, fantastic!
So a lot of what you see in some of the legislation that's passed in the last few years has been influenced by the education that congressional staffers have learned, both on the exhibition floor, in conversation and networking with our members.
Love it. Now I believe you actually are specifically responsible for bringing in some big guns from Washington at HIMSS, in addition to congressional staff. Tell us about them.
So we're very excited that we have the CMS administrator Seema Verma is speaking as part of the conference. We hear that she's got she's very much engaged in patients over process, patients over paperwork, and so how can using the power of CMS to really engage providers so that they're face-to-face looking at the patient and engaging the patient rather than looking at a computer screen, getting it back to care delivery.
Yeah, patient first. That's one of the themes I keep hearing.
Exactly, yeah. It's taken us a while to embrace that from a policy perspective.
Why? It seems so logical, right?
Well,
put patients first.
Who owns the data has always been the question. And at first it was the healthcare system or the provider. Now it's about the individual. So the community is really, from a policy perspective, really embraced the idea that it's patients first because it's their data and they should be actively engaged as consumers in their care. So they're not having care done to them, they're actively engaged. So if you look at the transformation of healthcare in the United States from a policy perspective these last few years, it's been about getting more value-based care, but also bringing the patient in as a consumer so that they're actively engaged and they're making better life decisions and they're working with their provider. Where the health IT community can help work is on the getting the right data available to the provider and the patient as a consumer so that they can help keep the individual healthy or get them healthier.
And how is it the government can help facilitate that process, that coming together of patient and provider and putting patients first?
It's really, the bottom line is getting regulations out of the way that are creating too much burden for providers, but also empowering technology that the consumer can use. If there's a patient portal, me for example, I have 5 doctors, 5 patient portals. Is there a technology that can aggregate them? I think there is.
Yes.
So how do we?
I hope.
You would hope, right?
Right.
So how do I then, if I'm the government, how do I rewrite the regulations so that not every doctor has to have a portal to be meaningful users or to be part of the incentive programs that have been in place? How do they engage in this aggregation so that the the patient's engaged and they're not, oh God, I don't remember the login for this portal. You know, so it creates more confusion. So get rid of the confusion, get rid of the burden. That's how government can really help.
Yeah, and then finally, you are going to be making some news here.
Yeah, we're very excited that we've been part for the last couple of years in working to integrate immunization data, whether it's individuals who've been immunized or who hasn't been immunized or where's the stockpile. So CDC has some tools out there that they've created. We've been brought in, HIMSS has been brought in to help to get their tools connected to the vendor community. And this week is on Wednesday, we'll be announcing the first 5 vendor organizations that have their product can work with the CDC tools. It's really going to help us launch immunization, who's immunized, who should be immunized.
Right.
Let's help get that data to, get that information available.
Groundbreaking, and it's happening here at HIMSS.
It's happening here at HIMSS. We're excited.
Yeah. Thank you. So are we.
Thank you.
All right.
Listen up, heart disease. You too, unnecessary ER visits. And hey, unmanaged depression. Don't get too comfortable. We're talking to you, cost inefficiencies and data without insights. And fragmented care. Stop getting in the way of patient recovery. And pay attention. Every single one of you is on our list. At Optum, we're partnering across the health system to tackle its biggest challenges. Optum, how well gets done.
Hey, it's Ben Choder, and I'm with Lagia Ricciardi, and I am really excited. She is the president of Clear Voice Consulting. She's a consumer engagement and digital health expert, and I am so excited to have you on HIMSS TV.
I am totally excited to be here, Ben.
And we're talking about probably my favorite topic of all healthcare topics, patient engagement.
Mine too.
Right?
What do you know?
If we can't get the patients engaged,
yep,
then why are we all here? Why are there 46,000 people at this conference if we're not going to do things that are going to be different and out of the box?
I think that's right. It's, as you know, it's not the way healthcare is always thought, right?
Exactly. So in your mind, right? So patient engagement is such a broad, term.
Yeah.
When you think patient engagement, what's the first thing you think about?
It's about having a sense of ownership and empowerment about your own health and well-being. So for me, it's not about some tool or an app. It's about how you think of yourself. Owning your health, owning your life, being responsible. Honestly, that even goes beyond just health and healthcare, but it's kind of an attitude.
Right. How important is technology?
It is important because it makes it possible to get information that you never could before and to connect to communities in a way that you never could before. I'm not saying you can't have very engaged people without technology, but particularly given all the many complicated factors in our world today and so many contribute to health, having data makes a difference.
Have you seen a big change over the last 2 to 3 years in patient engagement?
Oh, massive. So I've been going to HIMSS for years.
Right.
And a number of years ago, it was like you couldn't even say patient engagement. Right. People were like either, what do you mean? Or, no, I don't want to hear it. I mean, it's so incredible the way the thinking on this topic has changed. Now, that being the case, I mean, you hear a lot of conversation around HIMSS about, oh, this is a great idea. How do we engage patients? That's still not Main Street USA. That's still not happening everywhere.
But hasn't
we're getting there.
But hasn't it also muddied it a little bit because everyone says, every new startup says we're about making better patient engagement. Every readmissions app or technology comes out, it's about patient engagement. How do we cut through all the clutter?
Well, and part of the problem is a lot of people think like, oh, it's simple. Like we'll just do what we're doing and we'll add a patient portal and like, boom, engaged, magic. But it's really, it's a sort of deeper change than that.
It's changing culture, right?
Yeah,
it's not just create an app. There's no magic pill for it, right?
Exactly. That's what's at the core of it.
It's exciting.
It's totally exciting.
So is there any things that you've seen in the world of patient engagement that get you really excited?
Yeah, so I must say what gets me most excited is to see the things coming from outside the traditional healthcare world, kind of knocking on the doors of healthcare and encouraging everybody here to think differently. This isn't going to be like a big shocker to you, but it's like, I see we have pretty much the same watch, right? There's the Apple Watch, there's Alexa, there's Google, there's all these different companies that are coming from non-traditional healthcare places and saying, let's do things differently. We can use information technology and let's partner with or support, you know, sort of change things up in healthcare and encourage everybody to do things differently.
So it's little small things. Like, we're not going to change consumer behavior overnight, right? Patient engagement.
No, but again, like, the amazing thing is everybody's got, not everybody, but the majority of the US population has a smartphone in their pocket right now.
Yep.
That's like amazing computing power, the likes of which you found in a, you know, block-long building in the 1960s. You've got that power, so how are we going to harness that?
Are the payers and the providers taking it more serious?
Oh, I think absolutely. I think a lot of them are still figuring it out, and you've got all different points along the spectrum. You have some who are really creative and who are out there thinking about incentives for patients and using ways to connect them socially with one another for that kind of emotional incentives, in addition to, you know, here's some money or here's a discount on whatever. All of these points can help. But there's a lot too. I think increasingly there's a realization that you have to think about behavior change, not just as saying, do you know the facts? Like, we all know we shouldn't smoke, we shouldn't eat the cake, we shouldn't whatever it is.
But it's a little more than that.
It's more than that, and it's helping you at the point when you're making a decision, a million tiny little decisions that you make every day to sort of decide. I mean, it's sort of funny talking about this here in Vegas, right? Like, maybe I shouldn't have that extra drink. Maybe I should, you know, walk the extra mile, literally, which is not hard here, but yes.
This was amazing. Thank you so much for giving me a little of your time. Enjoy the rest of the conference, and I hope I get to talk to you soon. Thank you so much.
Sounds good. Thank you.
So now I'd love to go to our next package. Scott Weingarten. He's the MD, MPH, Senior Vice President, Chief Clinical Transformational Officer, Cedars-Sinai Health System.
I'm joined by Scott Weingarten. Thank you so much for joining me, Scott. How are you?
I am well. How are you?
I'm great. So tell us a little bit about your session, in particular, the improvements, you know, in the industry.
Yes, we're going to be talking about clinical decision support, and specifically how clinical decision support can be used to improve the value of care, improve quality while safely reducing cost of care. Not only clinical decision support of today, but what it'll look like tomorrow and how we expect it to evolve over time.
So what does it look like tomorrow and over time, say the next 5 years?
So the next 5 years, and even in the next year or so, you're going to see greater use of text-based information. So the clinical decision support reviewing the information in the electronic health record that's in free text, interpreting the information, and then providing off-to-the-side guidance to providers, which will hopefully enable them to take better care of their patients, more informed care, care informed by the evidence, better quality, at a lower cost.
So tell us a little bit about the successes that you've seen so far and the impact, particularly at Cedars-Sinai.
Yes, so we have seen a number of successes where clinical decision support is offered to providers as guidance, as suggestions, and in a number of cases the providers will change their care to be concordant with the evidence or the clinical decision support, and we've seen improvements in quality and safe reductions in cost of care.
Sure, so what has the patient reaction been to this?
Well, the patient reaction, patients may or may not, or often are not aware that the providers are receiving guidance in real time. They trust, in many cases, their providers to offer the best possible care to them. But we assume, or we strongly believe, that it's good for patient care. Yes. Anything that leads to better quality, better outcomes, lower mortality, lower morbidity, better quality of life, at a more affordable cost, should be good for patient care. That's the care I'd want for me, for my family, and members of my community.
Absolutely. So tell us, you know, the one key takeaway that you would like somebody to get out of your session.
Yes, I think the key takeaway is be optimistic. Today, there's a lot being said about alert fatigue and current generation clinical decision support, but I think in the very near future, and there are examples of this operating today with providers, you're going to see non-interruptive non-obtrusive clinical decision support that offers guidance that's helpful, that providers find helpful, that leads to better patient care, that looks not only at discrete data elements, but also text-based information. So I think it's a really exciting time to be in the field of clinical decision support. It's a great time to be in healthcare.
Excellent. So Scott, I would agree with you. Thank you so much for joining me today. This has been wonderful.
Thank you very much. Thank you.
Thanks, everyone.
I am really excited about our next interview. I know him very well, Dr. Ashish Trejo. He's the Chief Innovation Officer at Mount Sinai, and it is amazing. I've known you for a while. If there's anyone who's totally in the know, it's going to be you. And you basically have your hands in everything. I mean, you're everywhere. You understand, digital health. You understand, patient engagement. Wherever it goes, and you're a physician, you're right in the heart of it all. How exciting, first of all, is it to be at this conference?
I think this is great. This is a good conference to have a touch base on where the technologies were and where they are going, and you get a finger on the pulse of all those technologies. And meet peers. Right. I think you learn from each other, so I think it's very terrific for us.
All right, I got to ask you this because everybody, whether it's at this conference or back in New York, anyone with a new idea is always going to you. So what's getting you excited right now? 2018, what gets you excited?
Yeah, I think it's the platforms. I think we had seen so much different technologies in so much different fragmented ways. And that we in health system don't know how to take it, all those fragmented technologies, point of care. And we're seeing now emergence of platforms, whether it's a platform for AI, which has all the models and all the things built into it, rather than doing for one separate model, or a platform for digital medicines, right? So I think we are seeing kind of aggregation, which is a sign of maturity in how the technologies are emerging.
So you're seeing other institutions like Mount Sinai get excited about it because you were one of the first organizations that really embraced this new world. Are you seeing there's a big follow? Like everyone else is starting to join the bandwagon?
Oh, absolutely. And there's many pioneering institutions as well. If you talk about UCSF, UPMC, Colorado, they're doing a lot of these, I think, stellar institutions in each of the geographical areas, which are really doing top-notch job. And now we are also seeing, especially with Node Health, this consortium, that it's not just the pioneer academic centers. We are seeing so much interest from these community hospitals, underserved inner city hospitals. That's where.
So it's not just high; it's everywhere.
That's correct.
So for the audience members who don't know what Node is, can you just tell us what the organization is all about?
Absolutely. The main gap we had seen in the entire ecosystem had been that we were not talking, sharing, and learning with other health systems. Everyone was doing things on their own, and which means if there's a company used to come, we were running a pilot, another hospital was running a pilot. We call this syndrome as pilotitis, and it was killing the entire ecosystem. The startups did not get further ahead because all they had to do was small pilots. So we completely thought we're going to create a whole association of digital medicine. So that's what Node Health is. We brought 25 health systems together. We share and learn from each other what's happening. And we said, this is something ready for prime time, so let's all adopt it. And it has been a game changer for us and many institutions.
And I see, because I get your newsletter that goes around, and there's a lot of things going on. So what's your advice to other institutions who haven't totally embraced this? Is it, how did it get involved?
Right. So I think one is their conferences and meetups, whether it is this, or Connected Health Conference, or Node Health does a digital medicine conference that's completely focused on new technologies, happens in December in New York. So I think conference is one, but I think the other part would be subscription to newsletters like Mobi Health News, which is very good kind of archive list. I would say talking to peers, whether it is Chime or Node Health peers, and really being engaged on a more continuous levels rather than just meetings helps a lot. So we have a community channel, so anyone who joins Node Health, we actually make them part of that community channel, and they can ask questions, and we post all the worthwhile news. So that way you have finger on the pulse every time what's happening.
That's amazing. All right, before we wrap, is there anything else you want to tell the HIMSS TV audience?
No, this is great. I think we're in a very exciting time. I see two major technology waves over the last 15 years. One was the EHR. And now I think the bigger wave is digital medicine, which includes all those things from apps, telemedicines, AI. And I think that's going to completely change healthcare. And it's very patient-centric and very longitudinal versus EHRs, which are provider-centric and transactional. So I think the rubber meets the road now.
Ashish, thank you so much. Always great catching up with you, my friend.
My pleasure.
Have a great one.
Care. Thanks.
So, White House Senior Advisor Jared Kushner made a surprise appearance at HIMSS18 on Tuesday to announce a new plan that the Trump administration has for improving interoperability, so patients can get better access to the medical records. Kushner appeared on Tuesday ahead of planned speech by Seema Verma, who is the administrator of the Center for Medicare and Medicaid Services. Kushner said that President Trump is committed to making interoperability in healthcare a reality for all Americans. In other news, making presentations, Seema Verma, administrator for Medicare and Medicaid Services, said that patients should have access to their data in a timely manner because that will increase quality. Don't forget to join us tomorrow for our live broadcast. Thank you.